Counseling. Introduction. Counseling means choice, no force, no advice. Counseling is non-judgmental, confidential, changing. Counseling can help you work out what change you can make and how. Responsive to individual needs. Listening, having time to talk to someone who listens, understanding to help you make sense of what is happening in your life. Definition of counseling. Webster's Dictionary. Counseling is consultation, mutual interchange of opinions, deliberating together. According to James Mitchell Lee and Nathaniel G. Patton, counseling is a relationship between two persons in which one of them attempts to assist the other in so organizing himself as to attain a particular form of happiness adjustment to a life station, or in short, self-actualization. Counseling always involves one-to-one relationship, that is, one silent and one guidance worker in a formal or an informal interview station. According to Carl Rogers, a series of direct contacts with individuals which aims to offer him assistance in changing his attitude and behavior. Willie and Andrew. Counseling is a mental learning process. It involves two individuals, one seeking help and other a professionally trained person helping to first orient and direct himself towards a goal which leads to his maximum development and growth in his environment. Levels of counseling. Informal counseling. Important counseling is done by elders for years without any training, but is done better when some training is given to a counselor. Non-specialist counseling. It is the counseling which is done as part of the work of professional people such as nurses, doctors. Professional counseling. It is given by a fully trained professional person usually known as counselor. This training should consist of a master's or a Ph.D. in psychology or guidance and counseling with several years of supervised work in counseling. Nature of counseling. The term counseling is often confused with a number of related terms which are in use in educational literature. Similarities between counseling and health education. Both aim at changing behaviors in order to reduce risk. Both use two-way interactions between provider and silent. Both rely heavily on communication skills. Counseling and motivation. Counseling is more effective than motivation as it is initiated by the silent, while motivation means the healed person initiates the conversation. A motivator highlights the advantage while a counselor talks of both advantages and disadvantages. The motivator often makes the decision while counselor facilitates the silent to take a decision. Counseling and advice. The process of counseling different from the act of giving advice. Counseling is a scientific procedure adopted by an expert, whereas advice is a non-technical procedure which may be used by a teacher, a parent, a friend, or even an acquaintance in the time of need. Counseling and guidance. Counseling is a part of guidance, not all of it. It is a special or individual part which deals with individual at problem's point. Thus, all counseling is guidance, but all guidance is not counseling. Counseling. Counseling is used for normal persons who are troubled by some problem. Counseling is used in educational, vocational, and personal problematic situations. It takes advantage of educational tests and techniques and handles the data so gathered. Psychotherapy. It is used for such silents who have neurotic problems. Psychotherapy is used in therapeutic or medical station. Makes use of various therapeutic techniques such as suggestion therapy, play therapy, psychodrama, and Elements of counseling. It involves two persons, counselor and counselee. Setting for counseling. Competence of counseling. Counseling is assistance which the needy person receives. General. Counseling establishes relationship between two individuals, one who is beset with problem is at receiving end, the other who is professionally trained is at the giving end. Counseling demands free expression of one's person. Properly done counseling increases the counselee's self-confidence. Counseling is a personalized process which depends upon the dynamics of interpersonal relationship. Counseling leads to growth and development. Specific, rapport, communication, understanding, change in feelings and expressions, planning of counseling interview, principle of counseling. According to Han and McLean, it is strongly dedicated of self-direction and self-realization of the silent or the student. Silence need is to be put first. It is preliminary, a preventive and remedial process. Avoid dictatorial attitude. Maintain relationship of trust and confidence with the silent. Let the silent make voluntary informed decision. The silent's family members and significant influencing personnel must be included in counseling process. Maintain dignity of individual as individual is primary concern in counseling. Characteristic of counseling according to E. W. Feller. It concentrates on the normal individual. It considers breadth rather than depth. It involves a wide range of techniques. It must be a cooperative affair and the counselor must act as a point of contact. It shouldn't be solely based upon psychology. Skills required for effective counseling. Active listening. Reflecting. For example, silence. What do you think I should do about my wife's drinking problem? Nurse. What do you think you should do? Silent. My sister won't help a bit toward my mother's care. I have to do it all. Focusing. Taking notice of a single idea or even a single word. For example, like you and I can discuss together. Offering general leads. Offer the silent encouragement to continue. For example, yes, I see, go on. Summarizing and paraphrasing. For example, silent. I can study, my mind keeps wandering. Nurse. You have difficulty concentrating. Silent. I can take that new job. What if I can't do it? Nurse. You are afraid you will fail in this new position. Empathy. Observation. Realizing what is observed or perceived. This encourages the silent to recognize specific behaviors and compare perception with the nurse. For example, use sentence. I notice you are pacing a lot. You seem uncomfortable when you. Analyzing each option with the silent. The information given should include possible adverse reaction failures and ways to tackle them, e.g. to adopt the family planning method by eligible couple. The silent must be actively involved in the process of checking out the gains and costs involved in implementation of his/her decision. Non-therapeutic communication techniques in counseling. Giving reassurance, rejecting, agree or disagree, giving advice, probing, defending, using denial. Approaches for counseling. Directive counseling or counselor-centered counseling. Steps of directive counseling. Synthesis, diagnosis, prognosis, treatment or counseling follow-up, analysis. Advantage of directive counseling, economical in time. It emphasizes the problem and not the individual. The counselor can see the silence more objectively than the silent himself, lays more emphasis upon an intellectual rather than the emotional aspect of the personality of the individual. The methods used are direct, persuasive, and explanatory. Limitation of counseling. Counseling doesn't gain any liability of self-analysis. The counselee is over dependent on the counselor. Directive counseling doesn't guarantee that the counselee will not make mistakes in future. 2. Non-directive counseling. Assumption of non-directive counseling according to Carl Roger. Man has dignity, so he is trustworthy. The silent has the right to select of the goal of his life. Steps of non-directive counseling: defining problematic situation, free expression of feeling, positive and negative feelings classified, development of insight, termination of counseling station. Advantage of non-directive counseling: it is a slow but sure process to make the individual capable of making adjustments. No tests are used in it, and thus one avoids all that is laborious and difficult. It removes the emotional block and helps the individual to bring to preparation thought on conscience level therapy, reducing the tension. Limitation on non-directive counseling: slow and time-consuming process. The counselor is expected to exercise excessive patience. It requires high degree of motivation for the silent. 3. Eclectic counseling. Eclectic counseling defined as the synthetic and combination of directive and non-directive counseling. The counselor first takes into consideration the personality and needs of the counseling. Assumption of eclectic counseling: it is possible to maintain a continuum from non-directive to directive methods. Steps of eclectic counseling: making a tentative diagnosis, analysis of the problem, preparation of the tentative plan for modifying factors, securing effective conditions for counseling, interviewing and stimulating the silent to develop his own resources. Limitation of eclectic counseling: eclecticism is not possible because directive and non-directive concepts cannot merge together. Eclecticism is reduced, superficial, and opportunistic. Types of counseling: according to number of persons, individual counseling, group counseling. Tools and techniques used for individual counseling: standardized tools, techniques. Intelligence, achievement, aptitude, interest, and personality tests. Non-standardized tools, techniques. Questionnaire, interview, observation, cumulative record card, case study, rating scale, psychometric technique. Group counseling: it encourages team spirit and creates a climate of harmony, cooperation, and understanding. It applied in homogeneous group. Phases of counseling: Phase 5, termination and follow-up. Phase 4, intervention. Phase 3, setting goals. Phase 2, assessment. Phase 1, establishing relationship. Good counselor: always put the silent needs first. G. Good technical knowledge. O. Obtains appropriate information from silent. O. Objectively answers questions. D. Demonstrate professionalism. C. Confidentially maintained. O. Observant.
Also, they are found to be more anxious, sensitive to the expectations of others and society, patient and non-aggressive in interpersonal relationships, and showed appropriate self-control. Group counseling. Now you know what is counseling, what are the principles governing it, its different approaches to counseling, and the actual process involved. As you have already seen from the definitions, counseling has generally been considered considered as a one-to-one process. However, due to various reasons, this concept has undergone change. Now, the concept of group counseling has gained wide acceptance. One main reason for this is economic. There's shortage of resources in terms of money as well as trained personnel. Therefore, if a group of individuals can be helped at the same time, it is a great advantage. There are other benefits also. In a group settings, the individual tends to lose his identity and therefore responds more naturally. Moreover, group interaction helps to change some attitudes, beliefs, feelings, needs. Group counseling can be of great advantage to persons who are shy or aggressive in their interpersonal interactions, who are anxious or uncomfortable in groups, or who are unduly resistant of overconforming to social expectations. Also, special groups like alcoholics, abused, and other groups can profit more from group counseling. The meaning of group counseling. Group counseling is an extension of individual counseling. In group counseling, a number of individuals work together with a professional counselor to learn to resolve personal and interpersonal concerns. The primary goal of group counseling is the creation of an interpersonal climate which helps each individual to develop an insight into himself. It is a process in which free communication among members is encouraged and maintained, leading to an understanding and evaluation of each other's point of view. It is a means of helping to resolve problems by enjoying the social process of group dynamics and social facilitation. It is calculated to attain rapid amelioration in personality and behavior of individual members through specified and controlled group interaction. In group counseling, individuals explore and analyze their problems together so that they may understand them better, learn to cope with them, and learn to make valid choices and decisions. The group experience helps them to feel closer to others, to find and give emotional support, and to understand and accept themselves and others. Feelings of common direction and purpose develop as group cohesiveness increases. Group counseling has all the three dimensions of individual counseling with remedial, preventive, and developmental. However, in this situation, emphasis is given to the preventive and developmental aspects because schools are meant to be institutions for providing instruction and guidance to the students, majority of whom are normal. Therefore, in schools, the main concerns of group counseling is to prevent problems from becoming disturbing or incapacitating, and also to aid harmonious development. The assumptions of group counseling. Group counseling is based on certain assumptions. The first assumption is that individuals possess the necessary talent, capacity to trust and to be trusted by other group members. They should exhibit a basic concern for others in the group. This encourages group cohesion and provides an atmosphere of support and security for each member of the group to experience and share individual problems. The second assumption is that each individual has the potential to take responsibility for self-change. On the other hand, the individual feels that his life is controlled by others. He will not be left with any alternatives but take recourse to disruptive behavior. The third assumption is that group members can learn and understand from the objectives and methodology of group process. The objective is to reform the members and not to make them conform. Structuring of groups. Selection and induction of members. The most frequently used procedure for selection and induction of members for group counseling is a personal interview prior to assignments to group. The initial interview gives the counselor an opportunity to establish identification with the members so that feelings of respect, acceptance, and assurance is experienced from the beginning. To help the individual decide whether he wishes to join the counseling group, the counselor briefs him of the nature of the work, how it can benefit him, what can be expected, and the rules concerning confidentiality. This interview helps the counselor to decide whether an individual will be helped by group counseling and also whether a particular group will project or lose by one being a member. Size of the group. For group counseling, the size of the group should be relatively small. Although it is difficult to recommend a specific number. As a rule of thumb, about 6 to 10 members could be there in a group. Big groups become unmanageable. But too small groups are also not desirable because the group resources will be too limited and the tension to gets great due to the pressure to participate. Moreover, in too small a group where one or more members are absent by chance, the functioning becomes almost impossible. Composition of the group. There is controversy regarding the composition of groups for counseling. Opinions differ as to whether the group should be homogeneous or heterogeneous with respect to problems, education, intelligence, age, sex, and so on. Hinckley and Herman recommend heterogeneous groups make up all members with various complaints and symptoms. Harrison and Pever advocate grouping clients with similar concern and similar purposes for group counseling because the similarity facilitates a working bond and a more cohesive group relationship in the session. Gust argues that grouping in a for all members. Sometimes grouping in a similar age range permits the group to focus on developmental concern appropriate for all members. Sometimes a balance of males and females increases opportunities for women and men to share views about each other's behavior and attitudes. Although the opinions differ, almost all agrees that extreme differences are undesirable. Similarly, it is not desirable to include extremely hostile and aggressive individual because he makes it very difficult to create the atmosphere of acceptance and freedom from threat that is essential for group counseling. The chronic monopolist is also usually excluded from group counseling until his problem can be worked through sufficiently throughout individual counseling. Care should be taken to have a balanced group. The outgoing aggressive individuals should be inhibited, passive despondent members. Frequency and duration of meetings. Various recommendations have been made regarding the frequency of meetings. The population and the settings in which group counseling occurs determine the frequency and duration of meetings. Weekly and twice-weekly meetings are recommended most often. In a community agency, college, or in private practice, 2-hour weekly sessions are optional. But in the school settings, shorter durations, twice a week, may be more suitable because of the shorter attention span of younger students. Moreover, they will miss less class periods. In schools, groups usually run from 11 to 15 weeks. It is more convenient and at the same time it ensures a reasonable amount of time for the group to attain its goals. Physical settings. Physical setting is less important in comparison with emotional atmosphere and skill of the counselor. A skillful counselor and the group obviously will function more effectively in a poor physical setting than an inept one and his group in an ideal setting. However, privacy and freedom from interruptions are of course important. The room should be small rather than large. Seating should be flexible and varied. A circular seating arrangement with each member sitting where he pleases is to be preferred to be a formal arrangements and permanent seat assignments. The process of group counseling. The process of group counseling can be divided into different stages. The stages are initial exploratory stage. In the beginning sessions, group members are often strangers. They may be resistant to talk or only be able to bring up superficial topics for discussion. They may be shy or fearful of sounding stupid. They tend to focus on themselves and not on others. The counselor has to explain his role and also the roles of the group members. He has to set up facilitative conditions to help develop trust. The counselor can accomplish this by modeling genuineness, warmth, non-judgmental attitudes to group members, and by listening carefully. Members are encouraged to share their ideas and feelings frankly and freely. The counselor sets up facilitative and communicative attitudes and skills among participants by demonstrating and modeling this themselves. When the group members notice the non-judgmental manner in which the counselor reacts to positive as well as negative feedbacks from the members, they also readily accept the feedback in a healthy way. Transition stage. As the group moves from the initial exploratory stage to the next stage, group members are confronted with the need to explore more deeply, to self-disclose more intensively, and to interact more actively with others if they are to progress. Although some trust has been established by this time, the feeling is still tentative and the group members are anxious, ambivalent, and defensive as they realize that they are expected to explore more deeply the emotions and feelings that are painful. Some fear the group will reject them if they reveal too much. Some are even suspicious that the other members or the counselor himself may ridicule them. This stage is also characterized by conflict or rebellion resulting from a struggle for power, control, or dominance among the members and with the counselor. The group members tend to criticize each other frequently. They may even express doubts about the leadership of the counselor. All these behaviors represent the resistance to exploring painful feelings. Resistance is a sign that members are getting closer to the care of their problems. Resistance may manifest in various other forms, also like missing sessions, not participating, criticizing others, or simply talking with no mention of feelings. When resistance arises, counselors should encourage group members to work through conflicts and move toward more authentic self-explorations. Working stage. In this stage, the members feel more close to each other and more aware of others' problems. Since trust has increased, they are more willing to take risks in sharing feelings and thoughts and to give constructive feedback to each other. They are more supportive and cooperative and hence have more confidence in each other. But at this stage, there is a danger of this group intimacy leading to a false cohesiveness in which members protect each other and suppressing negative emotions. Counselors at this stage should confront the group members with their behaviors and insist that they challenge each other to convert insights they have gained in the group into action. For example, a group can confront a member who says he recognizes the need to assert himself but remains passive in the group and his interactions outside the group. Slowly, the group becomes productive and committed to going deeply into significant problems and to giving attention to interchanges in the group. There is a less dependence on the counselor and the group begins to focus on working towards specified individual goals and group goals. The group members feel free to confront each other and are more willing to accept confrontations as a constructive means to change. As the group interactions bring about attitudinal and behavioral changes in the group, members accept challenges among them to reform their everyday life. Counseling uses a variety of techniques in accordance with their theoretical orientations. Role playing, psychodrama, assertiveness, training are frequently used techniques. Consolidation on and termination. Termination is not simply the stopping. In fact, it is an integral stage of the process of group counseling. It is usually in group counseling to fix a termination date in advance. It is always wise to start discussion about the termination 3 or 4 sessions before the final one. It gives adequate time for handling psychological or emotional upsets associated with winning. To work toward transferring new experiences to outside world, to work through any unfinished problems, to review the experiences of individual members and work out how each can build on these changes once the termination is over. Suggestions for future help can also be made when necessary. Specific suggestions of how to build on new learning by joining a support group or other more advanced groups, by reading or by attending workshop may also be provided. Advantages and limitations of group counseling. Advantages. It is economical in many ways. In group counseling, a large number of individuals are helped at the same time by a counselor. This saves time and money. It helps individuals to socialize their attitudes, habits, and judgments. It provides multiple stimuli for each member to work through and approximates real-life situation. By frankly and honestly sharing their thoughts and feelings, members develop a feeling of group cohesiveness and singleness of purpose that helps them to progress. Discussions of matters of common concern help the members to appraise to adequacy of their interpersonal relations. The group gives them a practice field in which to learn new, more flexible and more satisfying ways of relating to others. Moreover, the group helps in the individual appraise his values and come to an increased appreciation of the importance of good human relations in his value system. Some individuals who cannot be reached through individual counseling can be reached through group counseling. In a group counseling situation, feelings of depression, isolation are reduced and talking made easy. Apart from this, group counseling gives the counselor an opportunity to study persons in an initial group settings. Limitations. Group counseling is not suitable for all individuals. Some individual finds the group situation too threatening. Moreover, some individuals have a very low level of tolerance and will not be able to adapt their behavior to the demands of the group. Similarly, very personal and private problems cannot be discussed in the group situation. Apart from this, the counselor has less control over the situation in group counseling. As a result, the counselor may sometimes find himself seriously impeded in establishing good working relationship with members. Therefore, the counselor has to take into consideration all these factors and decide whether group counseling is suitable for particular individuals and type of problem. Individual versus group counseling. There are differences as well as similarities between individual counseling and group counseling. Similarities. The aims of both are the same, with helping the counselee achieve self-understanding and become an integrated, self-dependent, self-directed, and responsible person. The techniques used are also similar, like clarification of feelings, restatement of contents, confidentiality, and privacy are maintained. The most important thing is the climate that is accepting, permissive, and non-threatening. The individuals who receive help in both are normally individuals who are trying to cope with stresses, frustrations, anxieties, or other developmental problems. Differences. Individual counseling is a one-to-one, face-to-face relationship where the counselor interacts with only one counselee. But in group counseling, the counselor interacts with a number of individuals at the same time. In individual counseling, the counselee only receives help, whereas in group counseling, the counselee also gives help to others. In group counseling, the principles of group dynamics find a lot of application. But in individual counseling, it is the relationship of the counselee with the counselor that is important. Specialized areas in counseling. So far, we had been discussing counseling in general with regard to its various aspects and related concepts. But some areas in counseling are such that they call for special expertise and techniques on the part of the counselor. These are recognized as special areas in counseling. Family counseling. Family counseling involves an interaction between professional counselor and a family, in which family members are helped to improve their communication and relationships so as to encourage the individual growth of each family member while achieving balance and healthy interactions among family members. Family counseling passes through four specific stages. Initial stage consists of developing a relationship and assessing the problem. In the middle stage, family members develop an emotional understanding of the reasons behind their problem. Ending stage is helping the family learn alternative ways of behaving, thus transforming the family system. Termination stage is the waiting period where the family is taught to function productively without the help of the counselor. In the initial sessions, counselors try to establish rapport, confidence, and trust. Each member is treated as important and insists that members should speak for themselves. Members are prompted to speak out what they think as their problem and also to discuss their expectations of the family. Counselors observe family dynamics, power structure in the family, communication patterns, and positive researches of the family. Members are helped to perceive themselves as a social unit. Family history, interaction with extended family members are also explored if need be. Once the problem has been refocused, goals are set and commitments of each family member is clarified. Whether to involve all members in one session or to hold separate sessions will also be decided. In the middle stage, members are helped to arrive at an emotional understanding of the problem. Counselor becomes more confrontative, leading to emotionally charged disclosures. Expression of unresolved grief, like that of loved one, divorce, loss of childhood, is encouraged at this stage. Here, members begin to realize that relationships can be changed for the better. With this, roles become less rigid and communication become direct and constructive. In the ending stage, members are encouraged to generalize these changes to interactions of home. And in the termination stage, the family is weaned and helped to function productively without therapist help. Review of what happened, discussion of potential problems ahead, and how they intend to handle the matter are helpful here. Career counseling. Career counseling refers to that professional relationship where the clients are helped to select, prepare for enter and function effectively in an occupation. According to A.G. Williamson, client problems could be classified into four categories with no choice, uncertain choice, unwise choice, and this discrepancy between interests and aptitudes. Process of counseling in these contexts is very much similar to that in general counseling because the development, choice, and establishment of a career are closely related to social and environmental influences and personality development. Client problems are identified and clarified through the establishment of rapport and on the basis of information so gathered. The counselor forms a tentative hypothesis. Client problem resolution is then accomplished with the help of the counselor followed by evaluation. The major difference being that in career counseling, additional information is gathered in occupational areas. Occupational history is reviewed, resort occupational testing if need be, and exploration of occupation and training possibilities are made. Finally, decisions about career choice or development are taken. Career counseling taught primarily confined to education in India. It has wide scope in community agencies and business for employee counseling and assistance programs. Also, specialized counselors do placement work and vocational rehabilitation counseling to help disadvantaged or handicapped persons with respect to jobs. Considerable research gone into this field shows that career counseling is generally beneficial. Counseling drug addicts and alcoholics. Drug addiction has reached epidemic proportions in our country. The ill effects of substance abuse are so many. These substances are psychoactive in the sense that they alter the mood, perceptions, and behavior. The so-called stimulate temper appetites, leading to nutritional deficiencies and serious physical ailments. Drug abuse also leads to serious interpersonal problems like domestic violence, child abuse, sexual dysfunctions. These substances induce cycle physical and psychological dependency, which makes it nearly impossible for the victim to get rid of the habit. Street crimes involving drug addicts are on the rise and reveals attempts made by them to get money to pay drug dealers. Drug abuse counselors emphasize inpatient residential treatment programs in highly structured and protected environments. This is because it is important to protect them initially from bad environmental influences. Moreover, medication is advisable in many cases to help addicts to withdraw from dependency that they have developed. The drug abuse counselors, after ruling out the need for hospitalization, induct the client into the counseling program. They insist that the client abstain from taking drugs as the first step, because without that, proper report of communication is impossible. Family members are also counseled and made aware of their faulty roles. Dysfunctional communication, which have caused or perpetuated the problem. Both the client and family members receive help to develop feelings of self-worth and responsibility for their behaviors. They learn to express their needs more directly. Through the exploration of childhood experience, they become aware of repressed negative emotions that are affecting their present behavior. They also learn new ways of dealing with stress. Drug addicts should receive group counseling because they often lack social skills. Auxiliary services like recreational or occupational therapy helps them to cultivate new interests. Nutritional guidance helps them to cultivate healthy eating habits. Counseling ensures their successful return to the society, thus alienating the problem once for all. Evaluation of counseling. The term evaluation refers to judging the effectiveness with which the objectives of a program are achieved in relation to specified standards. It may be improved adjustment, a sensible vocational choice, realistic self-concept, or better grades in school. So, in the context of counseling, evaluation means determining whether these goals were achieved or not, and if yes, to what extent. It is also the business here to see the effectiveness of various counseling approaches as well as the situations in which counseling can be used at its best. Problems in evaluation. Selection of criteria. As any other evaluation program, evaluation of counseling also presupposes a criterion to be used a yardstick to measure the counseling outcomes. A good criterion is one that is relevant to the problem which is to be studied and at the same time is measurable also. It may be easy to find a criterion relevant to a particular situation, but many a times they are so vague and abstract that it is difficult to quantify them. If proposed to choose a subjective criterion with the client's own judgment about the effectiveness of the counselor's judgment, chances are that at times they become too subjective to be reliable. Objective criterion, like the judgment given by a third party or a score in a psychological test, are usually found to be predictable and the best means of evaluation. But they also have their limitations, like if we take feeling of inferiority as the criterion, they cannot be observed by an outside agency. Psychological tests can be used here as an alternative, but at present only a few psychological tests are established to be valid. In fact, no test is valid for all situations and persons. Complexity of the goal to be evaluated. The goals of counseling many a times are to secure self-direction and self-dependence. With such goals, evaluation is not going to be a simple process because they are unique, complex, and dynamic. This especially happens in case of personal counseling rather than academic counseling, where the goals are mainly concerned with obtaining a better score in school, improving memory skills, study habits. Lack of adequate data regarding the pre-counseling status for comparison with best counseling status, thus making meaningful evaluation impractical. Evaluation in the context of counseling is a time-consuming process. Lack of trained personnel well-versed with the techniques of evaluation. Notwithstanding the difficulties and practical problems, we cannot do away with evaluation of counseling programs. Reasons are many. One reason is that the appropriateness and usefulness of a particular program cannot be judged without evaluating it. Secondly, it brings to light the limitations of a program, thus ensuring remedial measures and thereby improving the quality of the services rendered. Finally, for the clients themselves, evaluation provides a feedback motivating them towards better results. Now that we have seen the need for evaluation and the problems faced by researchers in this field, we will go to see the different ways in which evaluation is done. Survey approach. It's a very simple method. Here data are collected by surveys conducted on the samples selected for the purpose and hence the name. This approach consists of identifying the population, obtaining a representative sample from it, collecting information, employing suitable evaluative schedule, and finally interpreting the results in terms of determined criteria. Here the clients are asked questions directly or made to fill up questionnaires as how they feel about the usefulness of counseling, whether they have benefited from it. They are also asked to highlight any flaws observed and suggestions regarding possible solutions and means of improvement are also solicited. This method is a very useful approach since a large number of data can be collected within a reasonable time, which makes the conclusions more valid. Some drawbacks of this approach are unreliability of the subject's answers since they tend to give socially desirable answers, lack of experimental validation, and possibility of sampling errors leading to biased conclusions. Case study approach. This approach focuses attention on individual cases handled by counselors. Each case is analyzed in depth to assess the effectiveness of the counseling program attended by the client. Evaluation again is made using a subjective criterion like the client's judgments or client's own judgment regarding his progress. Objective criteria, as described earlier, may also be used subject to their own limitations. Advantage of this approach lies in its emphasis given to individual cases. A big drawback of this approach is that it is a time-consuming process. Also, since each individual is unique, it is improper to make generalizations based on such data. To counteract this, if we miss data pertaining of different individuals, it may miss the unique features of individual approach. Experimental approach. The basic requirements of the approach are determining the objectives or setting of a goal for the study undertaken, choosing appropriate method or design of the experiments, selecting two or more groups as the case may be, which are comparable to each other. Application of such counseling techniques, the outcome of which can be measured objectively, and analyzing the data and interpreting the results. The vital step in this approach is the selection of the comparable groups. In scholastic fields, as in counseling for improving study skills, comprehension, memory, reading ability, progress can be assessed easily throughout this method, whereas in areas like vocational choice and personal counseling, client satisfaction often is a complex phenomena which is not easily amenable to objective assessment. Usefulness of counseling. Now, we will summarize the conclusions arrived at throughout evolution studies of counseling programs. Follow-up studies have indicated that counselor students are more successful at school and after having also than those without an exposure to counseling even after controlling the motivation difference between the two groups. Significant differences in success rates has been observed. Counseling doesn't work equally well in all cases. Vocational counseling is found to improve vocational adjustment. Studies have proved that it is not the theoretical orientation of the counselor but his expertise is that which matters. Let us sum up. Different authors have defined counseling with differing emphasis on various aspects. However, most of them agree that counseling is a process and involves a relationship between professionally trained counselor and an individual in need to help. Psychotherapy, guidance, instruction, and advice giving are some fields closely related to counseling. All thought fields are closely related to counseling and there are some similarities in their function. They are different from counseling. Counseling as a scientific technique is based on a set of principles and assumptions. Counseling assumes that every individual is capable of taking his own decision and also that he has a right to choose his path. The counselor doesn't give him her advice or solves problems for him but only facilitates judicial thinking and decision making. Lack of proper understanding as to what exactly are the goals of counseling will lead to unrealistic expectations and resultant disappointment. Achievement of positive mental health, problem resolution, decision making, improving personal effectiveness, health change, and behavior modification are the major goals of counseling. These are three main approaches: directive, non-directive, and eclectic. Irrespective of the approach used, counseling generally passes through four stages with initial stage, middle stage, final stage, and termination. The effectiveness of counseling to a great extent is dependent on the personality and other characteristics of counseling. The concept of group counseling is gaining increasing popularity and main reason for this is economic. Certain areas in counseling require special expertise. Such areas are family counseling, career counseling, and counseling of drug addicts and alcoholics. As in the case of any other services, evaluation is essential for counseling services also. Evaluation helps in judging the effectiveness of the program. Coaching and counseling. Topics to be discussed. Definition: coaching. Opportunities for coaching. Aims of coaching. The coaching sequence. Benefits of coaching. Definition: counseling. Aims of counseling. Opportunities for counseling. Stages of counseling. Approaches to counseling. Benefits of counseling. Definition. Mentoring. Steps to perform. Mentoring functions. Advantages and disadvantages of mentoring. Definition. Coaching is a directive process by a manager to train and orient an employee to the realities of the workplace and to help the employee to remove the barriers to optimal work performance. Coaching is a person-to-person technique designed to develop individual KSAs. Effective coaching helps a subordinate to integrate with the organization and to develop a sense of involvement and satisfaction. Coaching only enhances competence. Employee must already have the right character. Opportunities for coaching. Appearing unmotivated, excessive errors, missing deadlines, falling below standards, displaying need to fine-tune skills. Aims of coaching: to help people become aware of how well they are doing, where they need to improve, and what they need to learn. Put controlled delegation into practice. Managers and individuals can use the situations that arise as learning opportunities. Rather than spoon feeding, only enable guidance on how to perform specific tasks. The coaching sequence. Identify the areas of KSAs where learning needs to take place to qualify people to carry out the task, provide for continuous development, enhance transferable skills, or improve performance. Ensure that people understand and accept the need to learn. Discuss what needs to be learned and the best methods of learning. Provide specific guidance, encouragement, and advice. Agree how progress should be monitored and reviewed. Benefits of coaching. Coaching is the most effective way to develop employees. It is the key to manage multiple priorities. Coaching leads to improved employee performance, which leads to increased productivity and bottom-line results. Coaching improves employee self-esteem and job satisfaction. Counseling. Definition: is a supportive process by a manager to help an employee define and work through personal problems that affect job performance. Counseling can also be defined as any activity in the workplace where one individual uses a set of skills, techniques, to help another individual to take responsibility for and to manage their own decision making, whether it is work related or personal. Aims of counseling: to encourage people to accept much of the responsibility for their own performance and development. what people feel and find out for themselves with some guidance as necessary is likely to make much more impact on their behavior than anything handed down to them by their manager. Opportunities for counseling: emotional outbursts, tardiness or absences, erratic behavior. Counseling stages: Institute of Personal Development gives the following: recognition, understanding, recognizing the existence of problems and issues, empowering, enabling employees to recognize their own problem or situation and encouraging them to express it, work out a solution and take action to implement it, researching, managing the problem, deciding on any further help individuals may need from their managers, a specialist, or an outside research. Approach to counseling: follow a non-directive approach. Following steps must be followed. Listen with intelligence, understanding. Be a sympathetic listener because attentive silence is often counselors' best contribution. Ask reflective questions. X. From what you have been telling me, am I right in believing that your situation or problem is? Avoid being judgmental. Counseling session is meant to encourage people, not to criticize them. Define the problem. Considerable amount of listening, questioning may be necessary before the point becomes clear, because clarity of expressions, strong emotions seldom go together. Need to ask questions like, is that the situation? Is there anything else that you want to tell me? Stay alert and flexible. Pre-plan the flow of the meeting, but in light of any new information, the counselor must be able to change direction. Change the perspective. Talking about a problem may change a person's perspective and lead towards the development of a solution. Observe behavior. How the person talks, reacts, and responds. Conclude the meeting. Help people to work out a solution to the problem that they can put into effect. They can be prompted by asking questions like, well, what do you think you should do now? Where do we go from here? Benefits of counseling. Mentoring. Definition. Mentoring is the process of serving as a trusted counselor or teacher to. Mentor is an individual with expertise who can help develop the career of a mentee. The mentor guides, trains, advises, and promotes the career development of the mentee. It's about learning, not teaching, and both mentors and those mentored grow from experience. In mentoring, people develop a synergetic relationship through a conversation that enables them to set and achieve goals, make decisions, and solve problems. Any person who has the skill to facilitate the mentoring process may be a mentor. Mentoring is enriching and satisfying for both partners. Here are a few actions that mentors can perform. They can choose challenging work assignments that will provide the mentee with opportunities to learn new skills. In this way, the task becomes the teacher and the mentee learns by doing. Integration of the mentee into the network of professionals within the company, external agencies, customers, and subcontractors and vendors. Schedule times to discuss strategies for enhancing the mentee's professional and engineering skills development. Providing feedback and supporting actions that reduce unnecessary risks for the mentee. Sharing experiences with the mentee. Taking the time to reflect on their own thought processes. Map problem-solving techniques by using a process flowchart to map out the mental steps they undergo while doing their job. Finding something of value in the mentee as a person. Finding ways to learn from their relationship. Two types of mentoring functions: career, psychosocial. Career functions help the mentee learn the ropes and prepare for career advancement. Coaching, challenging assignments, exposure and visibility. Protection, psychosocial function help the mentee develop a sense of competence and clarity of identity. Role modeling, acceptance and confirmation. Counseling, friendship. Advantages for the mentee: career advancement, salary, organizational professional identification. Advantages for the mentor: career advancement, passing the torch to a new generation. Learning from mentee, new technologies, new developments, important features of next generation. Disadvantages for the mentee: overdependence on the mentor, micromanagement from the mentor, negative halo from mentor who fails. Disadvantages for the mentor: mentee dependence on mentor, time, energy, commitment to mentee. Negative halo from mentee who fails. Counseling. Principles of counseling. Factors contributing to emergence. Industrializing. Changes in lifestyles. Changes in values. Changes in practices. Guidance movement. What is counseling? Counseling as hygiology. Counseling as a helping relationship. Counseling as a solution to human problem. Counseling is a process involving human beings. Counseling is a consultation deliberating together. Definition: counseling is a process involving an interaction between counselor and client in a professional setting which is initiated and maintained to facilitate changes in the behavior of a client. Goals: counseling aims at helping to deal with the developmental task appropriate to the client age, culture, and environment. Prevention of disruptive deviations. Long-range education and vocational planning. Preventive mental health. Creative help and helping normal persons to make choices in order to further their development. Alleviating normal anxieties and fear. 3 different bodies of supporters. The Phenomenological School, Social Workers. Nomothetic School, Medically Oriented. The Individual Difference School, Student Personal Services. Concept of human nature, essentially evil, essentially good, essentially natural. Potential of man, worth of the individual, right of freedom to choice, free to choice, responsible for actions. Models of counseling: the directive or authoritarian approach. Psychoanalytic approach, Sigmund Freud. Humanistic approach, Carl Roger. Techniques: psychoanalytic. Free association, dream interpretation. Analysis of resistance, analysis of transference. Rogers self-therapy. Each of us exists in a private world of experience in which the I, me, or myself is the center. Our most basic striving is toward the maintenance, enhancement, and actualization of the self. We react to situations in terms of our unique perception of ourselves and our world. We react to reality as we perceive it and in ways consistent with our self-concept. A perceived threat to self is followed by defense, including the narrowing and rigidification of perception and coping behavior, and the introduction of self-defense mechanisms such as rationalization. Our inner tendencies are toward health and wholeness. Under normal conditions, we behave in rational and constructive ways and choose pathways toward personal growth and self-actualization or fulfillment. Techniques: humanistic. The attitude, establishment of a non-threatening climate, considerable respect for clients, encourage clients to listen themselves concerned in clients' choices. Behavioristic approaches. All human behavior is learned. Behavior is the result of environmental forces and the individual's genetic endowment. Focused on stimulus in the environment could be related to the acquisitions, modification, and elimination of behavior patterns, rooted in a variety of theories of learning. Operationally defined, observable, and measurable. Classical conditioning, reinforcement, operant conditioning. Disagreements on the approaches. Psychoanalysis, man is a slave. Behavioristic, environmental pressures determine his behavior. Humanistic, importance of the individual potentialities. Existentialistic, makes his existence meaningful in terms of his uniqueness. Characteristics of the clients: negative self-image, poor social image, needs and motivation, failures of adjustment, frustration, threat, conflict, anxious, mild depression. Characteristics of the counselor: superior intellectual ability, originality, fresh and insatiable curiosity, interest in persons as individuals, insight into one's own personality, sensitivity to complexities of motivation, tolerance, and arrogance, ability to adopt a therapeutic attitude, industry, ability to tolerate pressure, acceptance of responsibility, tact and cooperativeness, integrity, self-control and stability, discriminating sense of ethical values, breadth of cultural background. Stages in the counseling process: need to help, enter into counseling relationship, expression and exploration of feelings and of problems, helping face, awareness of self and reorientation. Counseling process: a person-to-person relationships, mutual participation, structured around the felt needs of the counselors, self-direction and self-acceptance. Steps in counseling: an initial appointment, exploration of the client concern, development of a facilitated relationship, goal specification, identification, and consideration, implementation of a program towards goal achievement, evaluation of results, termination of relationship follow-up, counseling relationship, physical setting, privacy, acceptance, trust, understanding, responsibility, empathy, report. Classification systems in counseling: personality problems, difficulties pertaining to adjustmental problems, family conflicts, personal problems, educational problems, inadequate general scholastic aptitude, ineffective study habits, lack of motivation, underachievement, vocational problems, unwise vocational choice, differences between interest and aptitude, group for the advancement of psychiatry classification, healthy responses, reactive disorders, developmental deviations, personality disorders, psychoneurotic disorders, psychotic disorders, psychosomatic disorders, Bray syndrome, mental retardation, and others. MSE, physical appearance, separation, manner of relating, orientation to time and place and person, CNS function, speech and language, reading and writing, intelligence, memory, quality of thinking and perception, fantasies and inferred conflicts, affects, object relations, drive behavior, defense organization, judgment and insight, self-esteem, adaptive capacities, positive attributes, financial problems, need for self-support at school and college, health problems, inability to go about whose routine activities owing to problems of health, clinical counseling, analysis, synthesis, diagnosis, prognosis, counseling, desensitization therapy treatment, follow-up, classification by burden, dependence, lack of information, self-conflict, choice anxiety, lack of assurance. Psychotherapy aims at alleviation of human suffering, achieving personal change, fostering personal growth by the application of learning concepts, psychological principles, helping a person overcome difficulties inappropriate to their age, culture, or environment, primarily dealing with deviations already present and secondarily with prevention, permitting reality testing in a completely sheltered situation, producing personality change, remediation, curing or treating mental illness, bringing about change in the patient's personality so that adjustment difficulties are overcome, treating neurotic anxieties and fears. Happiness. Happiness doesn't happen. We have to make it. Life. Your world is very real and very much yours, but it may not be my world at all. For in the sense my world is a mental creation of my mind, just as yours is of your mind.
The role of pleasure. One of the criticisms of SWB is that it fixates too heavily on the experience of pleasure and positive effect, rather than what is meaningful. On average, human seeks pleasure and try to avoid pain due to activation of the brain's pleasure center. Rats. James Olds and Peter Wilner conducted an experiment where they placed an electrode into the hypothalamus of rats. When the rat pressed a bar, it would stimulate the electrode. Olds and Milner observed that the rats would press the bar up to 4,000 times an hour, foregoing eating, sleeping, and sexual behaviors, and neglecting to care for themselves in a similar way to individuals with extreme addictions. The researchers believed that they had found the brain's pleasure center. Since then, we know that the area they found is one of the several areas related to wanting and needing a certain stimulus to the point where nothing else matters. However, pleasure is not enough to make humans happy and fulfilled. Furthermore, when given the chance, individuals would rather exist in a real world with the potential to experience both pleasure and pain than a world that provides only pleasure and positive stimulation. Think about it. Imagine a machine that was able to induce only positive experiences due to cutting edge research completed by neuroscientists. You would not be able to tell that these experiences were not real. If you were given the choice, would you choose the machine over real life? Measuring SWB. SWB means subjective well-being. Subjective well-being encompasses how people evaluate their own lives in terms of affective and cognitive explanations. And there are multiple SWB scales. The majority of tools are single occasion, self-report tools such as the satisfaction with life scale and subjective happiness scale. The scales mentioned have reported very high levels of validity and reliability and are sensitive to change in life circumstances. Furthermore, the tools converge with mood reports, expert ratings, experience sampling measures, reports of family and friends, and smiling. The scales used are itemized and involve a very short time frame. For example, the questions are very basic and non-situation specific. Furthermore, researchers argued that moods can have a heavy influence over how you determine your satisfaction with life at any given moment. However, Diener argued that their research is not affected by the change in current mood and that life satisfaction is indeed stable enough to fight through the influence of a person's current mood. Other methods of research into SWL and SWB include comparing in-person interviews with anonymous questionnaires in order to contain impression management. Experience sampling methods has been employed in order to reduce memory biases. Finally, objective measurements are used in tandem with self-reports, reducing subjective bias. The feature of SWB measurements will rest on the reduction of questionnaires and cross-sectional surveys and the inclusion of more experience sampling or daily diary methods, qualitative descriptions, measures of cognitive and psychological aspects, as well as the use of longitudinal and experimental designs. Timeout. Gallup. George Gallup, the founder of what is now one of the world's leading poll companies, started his organization during the 1930s. From 1960 to 1980, the Gallup organization conducted extensive research into well-being. During the 1990s, the company began to look across the globe at satisfaction until 2005, when they conducted a groundbreaking, unprecedented global study on well-being, representing over 98% of the world's adult population in over 150 countries. Within these measured global studies, the following 7 areas were targeted, including law and order, food and studies, food and shelter, work, personal economy, personal health, citizen engagement, and well-being. Well-being is separated into 2 categories: objective and subjective. Since then, Gallup has created the Well-being Finder, an instrument based on these initial findings. After several pilot studies, including qualitative and quantitative inquiries, they concluded that 5 elements were essential for overall well-being. 1. Career well-being. 2. Social well-being. 3. Financial well-being. 4. Physical well-being. 5. Community well-being. They have also created a daily experience tracker which can be used to help individuals track their experiencing self, thereby highlighting in real terms good versus bad days. From their research, they concluded that a good day includes 10 circumstances, which are to be ranked on a scale of 1 to 10. 1. Feeling well rested. 2. Being treated with respect. 3. Smiling or laughing. 4. Learning or interested. 5. Enjoyment. 6. Physical pain. 7. Worry. 8. Sadness. 9. Distress, 10. Anger. Although the new well-being finder needs further research to increase reliability and validity, it is an interesting addition to Gallup's enormous database on happiness. Who is happy? Now that we are clear about how we are defining happiness within this chapter, we will move on to the date that we currently have on who is happy in the world. In reality, and from hundreds of thousands of datasets, it appears that most people are indeed happy. Although it is rare to be at the high end, the majority of people on Earth score in this somewhat satisfied set point. This means that at any given time point, the majority of people view stimuli and circumstances as positive. Thus, a common assumption people view stimuli and circumstances as positive. Thus, a common assumption that most people view themselves as unhappy appears to be false. For example, most people in most samples view themselves as above average in happiness. The exceptions to this appear to be those that are hospitalized, alcoholics, newly incarcerated inmates, new therapy clients, and students living under political suppression. Furthermore, the good news is that as individuals, we have a lot of sway in whether or not we become happy. Researchers postulate that after genetics, 50%, and life circumstances, 10%, we have control over approximately 40% of our happiness levels. Parenthesis, also called the 40% solution. Happiest places on Earth. So, which are the current happiest countries? Denmark, for example, has constantly scored with the highest ranking countries in happiness levels across the globe. For example, rank 1, country Costa Rica, 2, Denmark, 3, Iceland, 4, Switzerland, 5, Finland, 6, Mexico, 7, Norway, 8, Canada, 9, Panama, 10, Sweden. Time out. The sun. If you take a closer look at the table, you will notice that the majority of the happiest countries are situated in the northern part of hemisphere, where there is not a lot of sun and there is limited light. This is interesting as research has shown that when comparisons are made, people who live in colder climates also tend to have higher suicide rate than those in warmer climates. There are several explanations for this. For example, people in colder climates may be more diligent, and open in reporting suicides. Another explanation is what scientists call the sun bonus. A lack of sunshine can result in lower levels of vitamin D, which is directly related to serotonin in the brain. When people do not see light or sun for long periods of time, they can experience seasonal affective disorder (SAD) or depression from the lack of sunlight. This may explain the correlation with suicide, as well as the findings that people who experience higher levels of sunshine and daylight hours experience a boost of happiness through their proximity to the equator. Unhappiest places on Earth. World Values Survey for 1995 and 2007. Rank 1. Country Zimbabwe. 2. Armenia. 3. Moldova. 4. Belarus. 5. Ukraine. 6. Albania. 7. Iraq. 8. Bulgaria. 9. Georgia. 10. Russia. The most recent polls showed that Costa Rica now holds the title as the happiest country in the world. 5 ways to well-being. 2 major studies have recently revealed similar findings from their research endeavors. The Foresight Report, a collation of already completed pieces of research, and Gallup's most recent world poll, 1,050 plus countries, suggests 5 necessary elements for well-being. This section will review these 2 reports before going into more detail on the specific facilitators of well-being. The Foresight Report. The Foresight Report was conducted by the New Economics Foundation, NEF, to review all evidence-based research on ways to well-being. After reviewing over 400 pieces of well-being scientific research from around the world, suggested 5 consistent findings throughout the research that would increase well-being. Based on scientific evidence, the 5 ways to well-being include: connect. Research consistently shows that when we build connections with people around us, we experience higher levels of well-being, as well as stronger resilience in the face of adversity. The report suggests identifying the influential and important people in your life and investing time and energy into building those relationships. Be active. As discussed in more detail within Chapter 9, an important part of well-being is taking care of the body as well as the mind. The NEF, New Economic Foundation, found that activity is an important part of enhancing well-being. Simply moving the body can have a massive effect on your mood and cognitive functioning. Take notice. Following from the exciting research on soaring, this element refers to research that demonstrates that stopping to smell the roses actually can enhance our well-being. Keep learning. By engaging the brain and challenging yourself to keep learning, you can enhance levels of well-being. Give. As seen in results from random acts of kindness research, people experience high levels of well-being when they give something or their time to others. 5 essential elements for well-being. Based on new research from the Gallup organization, Red and Harder 2009 reveal 5 essential elements for well-being. Although they do not cover what may be morally important in life, these elements include in order of importance. 1. Career well-being. This represents where you spend most of your time during the day. 2. Social well-being. This represents your relationships and experiences of love. 3. Financial well-being. This represents how well you can manage your financial situation. Physical well-being. This represents your ability to have good health and energy. Another one, community well-being. The 5th. This represents your role and participation within the community you live in. The authors note that all 5 are essential and the pursuit of one over the others will hinder a person's well-being levels. The presence of all 5 is what distinguishes individuals who thrive from those who suffer. Harter and Rath state that approximately 66% of us are doing well in at least one of the areas. However, only 7% are doing well in all 5. Furthermore, as you can see, the 5 elements are all things that are within a person's control. So, from 2 very different types of studies and 2 very different types of results, what actually makes us happy? The next section will bring you through the wonderful work of SWB research, which will show you that what we think will bring us happiness does not always do so. What makes us happy? This section will review several proposed correlates and causes of happiness from the most recent polls, including income, relationships, and religion. Time out. The ladder of life. The central self-anchoring striving scale Cantrell 1965, has been included in several Gallup research initiatives, including Gallup's World Poll of more than 150 countries, representing more than 98% of the world's population, and Gallup's in-depth daily poll of America's well-being. The central self-anchoring skill, developed by pioneering social researcher Dr. Hadley Central, taps into happiness of the here and now and the future. When taking part, participants are asked the following. Please imagine a ladder with steps numbered from 0 at the bottom to 10. At the top, similar to the one below, using a visual make it easier to see cross-culturally where language is a barrier. Think a ladder. The top of the ladder represents the best possible life for you, and the bottom of a ladder represents the worst possible life for you. On which step of the ladder would you say you personally feel you stand at this time? On which step do you think you will stand about 5 years from now? 0, worst possible life. 10, best possible life. Diener, Kahneman, Tao and Aurora, 2009. Scoring. Thriving. Individuals who score 7 plus on their present life and 7 plus on their future life are considered to be thriving. This means that they are experiencing high levels of well-being on a daily basis. Thrivers tend to report significantly fewer health problems, fewer sick days, less worry, stress, sadness, and anger, and more happiness, enjoyment, interest, and respect. Struggling. Individuals who score 5 and 6 are considered struggling, meaning that they hold moderate views on their current and or future life situations. People who are struggling tend to report more daily stress and worry and claim double the amount of sick days in comparison to their thriving peers. Suffering. Individuals who score 4 and below are considered to be suffering, which means that they rate their life as very poor and do not see it changing in the future. Gallup have found that in comparison to their thriving peers, individuals who are suffering tend to lack satisfaction of basic needs and experience more physical pain, increased stress, worry, sadness, and anger. Think about it. What do you think of the ladder of life? Is it a reliable tool to use when researching happiness? If not, why not? Where would you point to on the ladder of life? Income and SWB. The verdict is in. The results have been counted and verified, and the answer is yes. Money does buy happiness. At least a little bit. When reviewing the GDP of 132 countries, individuals who live in countries with the high GDP, such as Norway and the USA, on average score higher on well-being measures than those living in countries with low GDP, such as Togo and Bulgaria. Replicated findings have confirmed this relationship between income and SWB in poor nations. This seems to be more apparent when assessing one's life in general versus immediate affective experiences. Think about it. Bhutan, a teeny country in Asia, has rejected the concept of gross national product. It is GNP, gross national product, as the measurement of its country's success, and introduced gross national happiness, GNH. Do you think this is a better way to measure a country's wealth? In the Gallup World Poll, Kasapir and Diener 2008, of 130 plus nations, which was a representative sample of 96% of the globe's population, there were striking disparities in health and consequences of income. Ultimately, income is linked to the satisfaction of basic biological needs such as food and shelter. In poor nations, with social welfare programs protecting against adverse effects of poverty in rich nations. Plus, there is greater income inequality, variability in poor nations. Income may also influence well-being because wealthier nations appear to have more human rights, lower crime, more democracy, more equality, more literacy, increased longevity, and better health. However, countries with higher income tend to have more competitiveness and more materialism and less time for socializing and leisure. Forbes. In 1985, E.D. Diener and his colleagues had the fortune opportunity to access 100 individuals on the Forbes list of richest Americans. An interesting survey asked several groups of people within several continents their rating of happiness. The results show that Forbes magazine's richest Americans, net worth over $125 million, scored only slightly above 5.8, the random control group. Furthermore, 37% of the rich list scored lower on happiness levels than the average American. Sandiener, 1985, for the original article. The high income in these countries correlates significantly with lighter prison sentence for the same crimes, better physical and mental health, increased longevity, lower infant mortality, reduced risk of being the victim of violent crime, reduced likelihood of experiencing stressful life events, reduced likelihood of being diagnosed with DSM depression, greater chance of a child completing school and not being pregnant as a teenager, and greater interpersonal trust. Furthermore, income tends to correlate modestly but significantly, even controlling for education, with marital status, occupation, employment, age, and sex. Marks and Fleming, 1999. Thoms, 1969, 1986. Blanchflower, 2001. Blanchflower, 2001. Interestingly, income is correlated with happiness in men, not women. And low personal income is related to depression for husbands, not wives. Low income is related to depression for single but not married women. And people with high income are perceived as more intelligent and successful, but also as more unfriendly and cold. There are several disadvantages to having and maintaining higher levels of income, such as spending more time at work and having less time for leisure and social relationships. Most importantly is the effect of the hedonic treadmill, which undermines happiness by forcing wealthy people to adapt to their conditions, raising expectations and desires, which makes it difficult for them to be happy with their current status. Ideally, research suggests that in order to maintain balanced levels of well-being, individuals must take home approximately $1,000, the equivalent of £3,000 per month. Anything more will do little to enhance happiness. Indeed, an extra $10,000 per annum will only bump up your happiness levels by approximately 2%. Think about it. Does money make you happy? Based on evidence from multiple studies, Red and Harter, 2010, suggests 5 tips for enhancing financial well-being. 1. Be happy with what income you do have. 2. Live within these means. 3. Spend wisely and save wisely by thinking long-term as well as short-term. 4. Spend on experiences and not just materials. Experiences create memories that can then be savored at a later date. 5. Spend your money on others and not just yourself. Relationships and SWB. Friends and acquaintances. One of the greatest predictors and facilitators of SWB is social relationships. We need other human beings and we like being around them. Whether we are introverted or extroverted, spending time in social settings enhances our levels of well-being. More specifically, the Gallup Healthways Well-being Index poll recently found that people need to spend 6 to 7 hours per day in social settings, and up to 9 if your job is stressful, to enhance or maintain well-being. People. Daniel Kahneman, a name you will be familiar with by now, conducted a study that employed the experience sampling method, which takes snapshots of people's happiness throughout their day. When people were buzzed, they were asked to write down what they were doing, who they were with, and how happy they were. The results showed that people were happiest when they were with others and unhappiest when alone. The order of most to least happiness inducing activities is socializing after work, relaxing, dinner, lunch, watching TV, socializing at work, talking on the phone at home, cooking, child care, housework, working, commuting from work, commuting to work. See Kahneman et al. 2004 for the original article. It appears that happiness is contagious, meaning that people who interact on a daily basis with happy people in small, large, direct or indirect networks are happier. Not only do friends and wider social networks influence our SWB, they can influence our likelihood of engagement with detrimental health behaviors, such as smoking. Marriage and SWB. Good news for all soon-to-be or recently married couples. Chances are you are experiencing what scientists see as an acute rise in well-being. An interesting causal relationship has been found between happier people and likelihood of marriage, with happier people being more likely to get married and stay married while still reporting a happy marriage. Longitudinal research has recently shown, however, that after the initial 1 year honeymoon phase, individuals return to their previous level of SWB. One caveat is that couples who cohabit and tend to report less satisfaction than couples who are married. Caveat: children and well-being. Despite what society may have told us about children as an infinite source of joy, research demonstrates on positive effect. Specifically, individuals who have children have lower scores on well-being measurement tools than those who do not. Furthermore, any additional children after the firstborn tend to reduce the well-being of parents involved. The relationship between children and marital satisfaction appears to be curvilinear, with high levels of the life satisfaction at the marriage ceremony, dropping significantly at the birth of first child, followed by a continued drop throughout childhood and adolescence, where it hits bottom, and then returning to higher levels after the children have left. Work, employment, and SWB. Work can have a tremendous effect on our overall well-being. Specifically, research has shown that how we perceive our job and our career orientation can further influence our happiness levels. Thankfully, it is not just doctors or nuns or what society feels as a meaningful job that creates happiness. Indeed, manual labor hospital staff and senators still report high levels of well-being in their work life. In fact, approximately one-third of employees in any sector or area of employment perceives work as a calling orientation. So, what is a calling orientation and how does it differ from other types of jobs? First of all, people who have a job orientation view their job in terms of a means to an end. The job equals money and is not important to their overall life. A career orientation is concerned with building a career, and such workers perceive the job they are in as a way to progress forward. Furthermore, these people are focused on the extrinsic rewards that can come with progressing in their career. Finally, a calling orientation is when workers are immersed healthily in what they do. They do the job not for money or the fame, but because they believe that is worthy in its own right. Think about it. What orientation did you adopt in your previous job? If you have had more than one, try and think about how it made you feel to start and end the day. If you dreaded getting up and heading to work or felt relieved by the end of the day, you most likely had a job orientation. Extensive research has been conducted on the relationships between happiness and success at work. The dangers of having a job orientation are that individuals who are simply waiting to punch out at the end of the day have higher levels of disengagement and stress and lower levels of reported happiness, except towards the end of the workday. Since work is a place where we tend to spend over a third of our day, we must ensure that we create a place where we want to be, where we like to be, and where we feel engaged. Researchers have found that certain personality characteristics are more predominant in certain occupational settings, and When personal and professional profiles are aligned, this can enhance satisfaction at work. Researchers have specifically looked at the interactions between the Big Five and six occupations: teachers, managers, service workers, craftspersons, manufacturing, and home workers. They found that a mismatch between personality profile and occupation led to reduced life satisfaction. Teachers scored the highest in life and job satisfaction. However, the mix of personality traits in teachers explains some of this. It appears that the most important character trait for satisfaction with work is strength of vitality. Think about it. Do you like what do you each day? Harter and Roth, 2010, state that only 20% of us will respond with a resounding yes. Health and SWB. Diener and Diener separate the effects of SWB on our physical condition into three health categories. A. The likelihood a person will contract a specific illness. B. How long a person lives after contracting a life-threatening illness. C. How long a person's lifespan is. Within the first category, longitudinal research has shown that people who experience higher levels of positive emotions are protected from various illnesses, including heart disease. Quotes. Positive emotions may be the key to protecting yourself against those pesky winter colds. Sheldon Cohen, PhD, of Carnegie Mellon University, conducted a groundbreaking experiment on the beneficial effects of positive emotions on immune system functioning. For 2 consecutive weeks, 334 volunteers were assessed on their day-to-day experience of positive and negative emotions. Parenthesis, vigor, well-being, and calm, depression, anxiety, and hostility. Once their data had been collected, the experimenters secured a rhinovirus, otherwise known as the common cold. Participants' noses. The experimenters then kept the participants under observation for 5 days in a hotel specifically cleared for the experiment. The researchers were interested in whether or not the participants caught the cold and to what degree they showed any symptoms. The results showed that individuals who experienced higher levels of positive emotions were more resistant and showed less severe symptoms than those that displayed less positive emotions. Thus, you could say a smile a day keeps the doctor away. You could say a smile a day keeps the doctor away. The second category, surviving after the diagnosis of a life-threatening illness, is slightly more complicated. When someone has balanced levels of positive emotions and optimism, their health can be positively influenced. However, when people adopt a positive viewpoint, which hinders the adoption of medical advice and treatment, high levels of happiness can be detrimental. Researchers argue this is because happier people are more likely to be too optimistic and delay seeking medical advice for potentially cancerous symptoms. Finally, when defining health in terms of longevity, the research shows quite simply that happier people live longer. Rasmussen and Pressman, 2009. Psychologists. As a follow-up from the famous nun study, Sarah Pressman analyzed the autobiographies of 96 famous psychologists. The results echoed the latter study. The results echoed the latter study with psychologists who used more positive feeling words living, on average 6 years longer than those that used more negative feeling words. Religion of SWB. People who report themselves as being spiritual or religious tend to report slightly higher levels of well-being in addition to higher scores on hope and optimism. But do all religions make us equally happy? And if so, what elements of religion? Is it the belief in organized religion or just a sense of spirituality? The belief in something higher, the concept of the afterlife, attendance at religious ceremonies and adherence to religious practice. Research in America shows that people who identify with any of the above forms of religiosity score mildly happier than those who do not. This effect is not present cross-culturally, however, and depends on the type of religion followed. Researchers expect that this is due to the unique elements found within different religious beliefs and their links to anxiety, guilt, and oppression. Furthermore, religions that isolate and denigrate other religions and members out with the community can cause unhappiness. In order for a religion to enhance well-being, Diener and Biswas Diener 2008 proposed that the elements needed are comforting beliefs in what awaits us on the other side, social support from a community, connecting to something permanent and important that can give comfort, meaning, and a sense of identity. Growing up religiously, which may influence a solid upbringing with a clear set of values and morals to abide by. experience of rituals that excite, amaze, and involve the congregation and its followers. Think about it. If you were an atheist or agnostic, how could you adapt to principles of religion for a happier life? Age, gender, and education. Again, contrary to popular belief, scientists have found that elderly individuals are as happy as their younger counterparts. With regards to gender, there appears to be no significant differences between the happiness levels of men and women. Finally, people who score high on well-being tend to have a higher educational attainment than those who score lower on the scales. Think about it. Are there any other correlates that you expected to be on the list? Example, climate. Theories of SWB. So now that we know the potential correlates and the outcomes of SWB, why does it occur? We are still searching for answers as to what are the causes and or consequences of well-being. Proposed two approaches to understanding coaching with SWB research, bottom-up and top-down causation. Bottom-up approaches attempt to find which particular variables, for example, genetics, personality plus, demographics, age, sex, ethnicity, and so forth, cause SWB. Top-down approaches begin to understand SWB as producing certain outcomes. Genetics and SWB. There appears to be a strong genetic influence on the individual's well-being. Indeed, researchers have found predictive variability in life satisfaction according to personality traits. Dynamic equilibrium theory states that personality determines baseline levels of emotional response. Events may affect us in the short term. However, over time, we eventually revert to our genetic set point. Furthermore, people who are happy in their home life tend to be happy at work, thus displaying consistency across situations, work or leisure. Recently, set point theory has been contested by novel research findings. Haday, 2010. However, at the present time, set point theory tends to dominate the positive psychology discipline and underpins support for positive psychological interventions. Epigenetics is the area of biological research that looks at the causal interactions between genes and environment. More specifically, research has started to show that the environment can have an influence on gene expression and behavior, especially in the mother-infant relationship during key developmental phases, thereby influencing brain development, behavior, as well as risk and resilience to health and disease. Adaptation theory. Humans have a unique evolutionary tendency to react strongly to recent events. However, this diminishes over time, approximately 3 months. Following multiple studies, researchers have suggested that humans tend to have natural happiness set point, which following good and or bad news events, we tend to revert back to after approximately 3 months. This evolutionary adaptation process, hedonic adaptation theory, otherwise known as the hedonic treadmill, is linked to zero-sum theory. This evolutionary adaptation process, hedonic adaptation, is linked to zero-sum theory, which posits that happy periods in our life are inevitably followed by negative periods, which cancel each other out, and thus any attempt to increase happiness will be unsuccessful. Lottery. Do you play the lottery? If so, why? Do you believe it will make you happier? Unfortunately, Brackman's monumental longitudinal study on happiness among lottery winners suggests otherwise. Lottery winners who won amounts ranging from $50,000 to $1 million were interviewed on the basic demographic variables and questions pertaining to how their life had changed since winning. The lottery winners related everyday events as less pleasurable than the control groups and were no happier than they were before winning. In relation to 11 paraplegics and 18 quadriplegics, the lottery winners scored the same on happiness levels. This does not mean that paraplegics were happy about their conditions. In fact, they tended to have a positive reflection on their past, but a low satisfaction with everyday present life. Ultimately, these experiments support the theory of hedonic adaptations, that, bad or good, we have natural set point that we will inevitably return to. The proposed antidote to this adaptation is variety. Hence, individuals must continually change their approach and happiness interventions in order to counteract an adaptation mechanism. As reflected in the hedonic adaptation prevention HAP model, Libomirsky in press, new research has shown that an individual's number of positive events directly affects the number of experienced positive emotions, which helps sustain well-being, all moderated by surprise and variety as well as intrinsic desire for change. Think about it. Recall a time in your life when you were up for promotion, expecting an exciting event or bought a new item. How did you feel when this happened? How did you feel a week later? A month later? Reflect on the impact that moment has on your right now. Daniel Gilbert, 2007, focuses on the concept of effective forecasting and how this affects our ability to be happy. With the unique ability of humans to be able to think and imagine, the future comes interesting and powerful consequences. Vasco and Puri, 2009. Impact bias is an evolutionary quirk that distorts our perception of the hedonic impact of future events. We may think that two outcomes, such as passing a test or failing a test, will have distinct intensity and durational differences on us. However, this rarely turns out to be true. Tenure. Linked to effective forecasting, Gilbert, 1998, conducted 6 studies that aimed to assess the discrepancy between how people forecast the impact of negative and positive news, as well as their subsequent emotions after achieving or failing to receive tenure. The results showed that those who had been denied tenure overpredicted how negative they would feel, whereas assistant professors who were given tenure overpredicted how happy they would feel. For both groups, their long-term happiness level forecast was deemed accurate. In fact, the only life experiences that have been found to have longer lasting negative impact on our happiness is the death of a spouse and long-term unemployment. Bereavement is one of the most devastating life events and has a significant impact on individuals' well-being. Researchers propose that it takes approximately 5 to 7 years to return to previous levels of well-being. The damaging effects of unemployment, on the other hand, are harder to recover from. In the same study, Clark followed over 130,000 individuals over several decades. They found that men who were unemployed for a long period of time, more than 1 year, didn't return to their previous levels of well-being. Furthermore, according to Gilbert, 2007, humans synthesize happiness. Natural happiness is what we feel when we get what we want. However, synthetic happiness is what we make when we don't get what we want. Gilbert argues that synthetic happiness is just as real and beneficial as the other type of happiness, and that perceptions of synthetic happiness as an inferior kind of happiness are incorrect. The reason we developed this evolutionary ability to synthesize happiness is argued to be due to the belief that we need to keep going and get what we want. Otherwise, we had give up if we knew we would be just as happy as we did not. Discrepancy theories. The American paradox, Myers, 2000, refers to the phenomenon that, despite an increase In wealth across the globe over the past 50 years, happiness levels have stayed the same. There are several explanations for this. The first is the relative standards model, which is reasonably well supported. Subjective well-being is primarily a function of comparison process, social comparison with past self, with internalized standards. When we interact with others, we can't help but compare ourselves to them on many levels. Otherwise, termed as social comparison, we can compare our situation, attractiveness, and wealth to others either in an upward or downward spiral. Ultimately, we tend to seek out and interact with people who make us feel good about ourselves and not people who make us feel bad. Thus, our brand new designer handbag is only great until we see a bigger, more expensive and new season one on a friend. On the other hand, if we see a friend with a less expensive handbag, we will feel better about our status and ourselves. Our personality may influence whether we use downward or upward social comparison and how we use it. The cancer patients that Kate has worked with use it in both ways, however, in a positive ways. They use upward social comparison when looking at cancer patients who have finished chemotherapy and think, someday that will be me. Alternately, they will look around and follow patients, some who are younger with children, and think, well, at least I got it now, rather than when I was young, like them. Thus, social comparison is only detrimental if you use it to negatively evaluate yourself with others. Status anxiety and materialism have been linked to increased instances of depression and lowered SWB. The NR and Oshie 2000 found that placing high importance on money correlates inversely with life satisfaction, whereas placing high value on law correlates positively with life satisfaction. Some seculars go even further and claim that materialistic attitudes can be equated to a virus called affluenza that causes dissatisfaction and worthlessness, crippling our lives. Although originally a metaphorical expression, affluenza seems to have its roots in rigorous research finding. Think about it. Taking from a well-known economic query, Solnick and Hemingway, 1998, to test the rationality of individuals and finance, please answer the following questions. Would you rather earn $50,000 a year while other people make $25,000? Or would you rather earn $1,000 a year while other people get $250,000? Assume for the moment that prices of goods and services will stay the same. What did you say? Would it surprise you to know that the majority of people who are asked this question would prefer the first scenario? Why do you think this is? Previous beliefs were that striving for material goods does not meet basic human needs, and that materialistic goals may be unattainable. Furthermore, unhappiness and low social support might lead to compensatory materialism. However, an argument against the detrimental effects of materialism is that materialism is only bad if you cannot afford it. Thus, those who report being higher on materialism with higher incomes report higher well-being. As long as you live within your means and can afford what you like without the financial strain, materialism is not as detrimental as previously believed. Linked to discrepancy theory is the paradox of choice. As nations become richer and consumers become more demanding, our world is packed with choice, alternatives, and variations to most everything for sale. Freedom of choice has now been replaced with the tyranny of freedom, where more choice is not necessarily a good thing. Think about it. Can you recall a time when you wanted to buy a specific item, a new computer, for example? How many choices were there? Did this make things easier or harder on your final decision? An abundance of choice has led to three leading problems for consumers and citizens of Western societies. These include information problems. We are swamped with information, which leaves us in a precarious position. How can we possibly gather all we need to know in order to make an educated choice? Error problems. If we are not able to access all information about all the possible choices, we are likely to make more errors of judgment. Psychological problems. The stress and anxiety caused by excess choice and the above issues can create lowered levels of psychological well-being. Of course, introducing choice is not necessarily the issue here. It is introducing too much choice that seems to affect one's levels of happiness.
unbiased, and non-judgment. S. Sensitive to needs of the silent. E. Emphatic. L. Listen effectively. L. Let the silent make decision. O. Open mind. R. Respect the rights of the silence. Qualities of counselor: interpersonal relationship, personal adjustment, educational background, health and personal appearance, leadership, philosophy of life, professional dedication. Function of counselor: program of guidance, counseling and its organization, orientation, data collection, interviewing, individual counseling, outside agencies, placement and follow-up. Problems in counseling: resistant to counseling either by counselor or by faculty. Counseling with different cultures: the nursing students will come from different cultural backgrounds. They will have their own set of values and expectations. Counseling individuals with strong emotions such as anxiety, anger, depression, intimacy, which will hinder counseling process. Counselor burn out the symptoms such as restlessness, boredom, irritability, lethargy, fatigue. Negative feelings can be managed by changing role, environment, approach, taking care of themselves, e.g. enough sleep, rest, diet, play, entertainment, accept others' with. Lack of awareness of value of counseling by public, inadequate administrative setup, lack of physical facilities, non-availability of time and tools, dearth of training facilities for counselors. Culture: reasons for ineffective communication and counseling. Ineffective communication skills used by counselor. Failure to listen on the part of the counselor. Conflicting verbal and non-verbal messages. A judgmental attitude. Misunderstanding because of multiple meaning of English words. False reassurance. Giving advice rather than encouraging the person to make decisions. Applications of counseling: nursing, employee counseling. Counseling helps improve employees' mental health, thus enhancing understanding, self-control, self-confidence, and consequently their ability to work effectively improves upward and downward communication, allows employees to express their feelings to management. Individual homes must be kept confidential, e.g. directive counseling occurs when counselor listens to employees' problems, decides how to solve the problems, tells the employee what to do. Outplacement counseling. Outplacement counseling can be used to minimize the emotional and professional scaring that result from being dismissed from one's position. Student counseling, adjustment counseling, crisis counseling. Marriage counseling, vocational counseling, behavioral counseling, interpersonal counseling, bereavement counseling, problem-solving counseling, dietary counseling, motivational counseling, physiological counseling, clinical counseling. Keep moral high. Individual counseling theory and practice summary. The effective counselor. The most important instrument you have is you. Your living example of who you are and how you struggle to live up to your potential is powerful. Be authentic. The stereotyped professional role can be shaped. If you hide behind your role, the ceiling will also hide. Be a therapeutic person and be clear about who you are. Be willing to grow, to risk, to care, and to be involved. Personal characteristic of effective counselors: have an identity, respect and appreciate themselves, able to recognize and accept own power, open to change, make choices which affect their lives. Feel alive, make life-oriented choice, authentic, sincere, and honest. Have a sense of humor. Make mistakes and admit them. Live in the present. Embrace the influence of culture. Sincere interest in welfare of others. Involved in and drive meaningful work. Maintain healthy boundaries. Ethical decision making. The principles that underlie our professional codes: benefit others, do no harm, respect others' autonomy, be just, fair, and faithful. The role of ethical codes: they educate us about responsibilities, are a basis for accountability, protect clients, are a basis for improving professional practice, making ethical decisions, identify the problem, review relevant codes, seek consultation, brainstorm, list consequences, and decide. Silence rights. Silence need enough information about the counseling process to be able to make informed choice. Educate silence about their rights and responsibilities. Confidentiality is essential but not absolute. Exceptions. The silence poses a danger to other or self. A silent under the age of 16 is the victim of abuse. The silence needs to be hospitalized. The information is made and used in a court action. The silent rescue is a release of record. Multicultural issues. Biases are reflected when we neglect social and community factors to focus unduly on individualism. As is silence with instruments have not been normed on the population they represent, judged as physicopathological behaviors, beliefs, or experiences that are normal for the silence culture. Dual relationship. Some helpful questions. Will my dual relationship keep me from confronting and challenging the silence? Will my needs for the relationship become more important than therapeutic activities? Can my silence manage the dual relationship? Whose needs are being met, my silence or my own? Can I recognize and manage professionally my attraction to my silence? Psychoanalytic theory. The development of personality, oral stage, related to later mistrust and rejection issues. Anal stage, related to later personal power issues. Phallic stage, related to later sexual attitudes. Latency stage, a time of socialization. Genital stage, sexual energies are invested in life. The structure of personality, the ID, the demanding child, ruled by the pressure principle, the ego. The traffic cop, ruled by the reality principle, the superego. The judge, ruled by the moral principle, the unconscious. Clinical evidence for postulating the unconscious. Dreams, sleeps of the tongue. Physiognomic suggestion. Material derived from free association. Material derived from projective techniques. Symbolic content of psychotic symptoms. Note: consciousness is the only slice of the total mind. Ego defense mechanisms. Ego defense mechanisms are normal behaviors which operate on an unconscious level and tend to deny or distort reality, help the individual cope with anxiety, and prevent the ego from being overwhelmed, have adaptive value if they don't become a style of life to avoid facing reality. Psychoanalytic techniques. free association. Silence reports immediately without answering, and feelings are thoughts. Interpretation. Therapist points out, explains, and teaches the meanings of whatever is related. Dream analysis. Therapists use the royal road to the unconscious to bring unconscious material to light. Transference and content transference. Transference. The silent reacts to the therapist as he did to an early significant other. The allows the silent to experience feelings that would otherwise be inaccessible. Analysis of transference allows the silence to achieve insight into the influence of the past. Contact transference. The reaction of the therapist towards the silence that may interfere with objectivity. Resistance. Anything that works against the process of therapy and prevents the production of unconscious material. Analysis of resistance. Help the silent to see that canceling appointments, filing from therapy prematurely are ways of defending against anxiety. These acts interfere with the ability to accept change, which could lead to a more satisfying life. Adlerian therapy. Alfred Adler's individual psychology. A phenomenological approach. Social interest is stressed. Birth order and sibling relationship. Therapy as teaching, informing, and encouraging. Basing mistakes in the silence provide logic. The therapeutic relationship, a collaborative partnership. The phenomenological approach. Adlerians attempt to weave the world from the silent subjective frame of reference. How life is in reality less important than how the individual believes life to be. It is not the childhood experiences that are crucial. It is our present interpretation of these events. Unconscious instincts and our past don't determine our behavior. Social interest. Adler's most significant and distinctive concept refers to an individual's attitude toward an awareness of being a part of the human community. Mental health is measured by the degree to which we successfully share with others and are concerned with their welfare. Happiness and success are largely related to social connectedness. Birth order. Adler's 5 physiological positions. 1. Oldest child receives more attention, spoiled, center of tension. 2. Second of only 2, behaves as if in a rise, often opposite to first child. 3. Middle, often feels squeezed out. 4. Youngest, the baby. 5. Only doesn't learn to share or cooperate with other children, learns to deal with adults. Encouragement. Encouragement is the most powerful method available for changing a person's beliefs. Helps build self-confidence and stimulates courage. Discouragement is the basic condition that prevents people from functioning. Clients are encouraged to recognize that they have the power to choose and to act differently. Existential therapy. Existential therapy. Physiological, intellectually approach to therapy. Basic dimensions of the human condition: the capacity for self-awareness, the tension between freedom and responsibility, the creation of an identity and establishing meaningful relationship, the search for meaning, accepting anxiety as a condition of living, the awareness of death and non-being, the capacity for self-awareness. The greater our awareness, the greater our possibilities for freedom. Awareness is realizing that we are finite, time is limited. We have the potential, this choice, to act or not to act. Meaning is not automatic. We must seek it. We are subject to loneliness, meaninglessness, emptiness, guilt, and isolation. Identity and relationship. Identity is the courage to be. We must trust ourselves to search within and find our own answers. Our great fear is that we will discover that there is no care, no self. Relatedness. At their best, our relationships are based on our desire for fulfillment, not our deprivation. Relationships that spring from our sense of deprivation are clinging, parasitic, and symbiotic. The search for meaning. Meaning, like pleasure, meaning must be pursued obliquely. Finding meaning in life is a byproduct of a commitment of creating, loving, and working. The will to meaning is our primary striving. Life is not meaningful in itself. The individual must create and discover meaning. Anxiety, a condition of living. Existential anxiety is normal life, cannot be lived, nor can it be faced without anxiety. Anxiety can be a stimulus for growth as we become aware of and accept our freedom. We can blunt our anxiety by creating the illusion that there is security in life. If we have the courage to face ourselves and life, we may be frightened, but we will be able to change. Relationship between therapist and silence. Therapy is a journey taken by therapists and silence. The person-to-person relationship is key. The relationship demands the therapist be in contact with their own phenomenological world. The core of the therapeutic relationship. Respect and faith in the silence potential to cope, sharing correction with genuine concern and empathy. Person-centered therapy. Person-centered therapy, a reaction against directive and psychoanalytic approaches. Challenge the assumption that the counselor knows best, the validity of advice, suggestion, precision, teaching, diagnosis, and interpretation. The belief that silence cannot understand and resolve their own problems without direct help, to focus on problems over persons. Person-centered therapy. Emphasis. Therapy is a journey shared by two fallible people. The person's innate striving for self-actualization, the personal characteristic of a therapist, and the quality of the therapeutic relationship. The counselor's creation of a permissive, growth-promoting climate. People are capable of self-directed growth if involved in a therapeutic relationship. A growth-promoting climate. Congruence. Genuineness or realness, unconditional positive regards, acceptance and caring but not approval of all behavior, accurate empathic understanding and ability to deeply grasp the silent subjective world. Helper attitudes are more important than knowledge. 6 conditions. 1. Two persons are in psychological contact. 2. To first, the silence in experiencing incongruency. 3. The second person, the therapist, is congruent or integrated in the relationship. 4. The therapist experiences unconditional positive regard or real caring for the silence. 5. The therapist experiences empathy for the silence internal frame of reference and endeavors to communicate this to the silent. 6. The communication to the silence is, to a minimal degree, achieved. The therapist focuses on the quality of the therapeutic relationship, serves as a model of the human being struggling toward greater realness, is genuine, integrated, and authentic without a false front, can openly express feelings and attitudes that are present in the relationship with this silence. Gestalt therapy. Gestalt therapy, existential and phenomenological, it is grounded in the silence here and now. Initial goal is for silence to gain awareness of what they are experiencing and doing now, promotes direct experiencing rather than the abstractness of talking about situations. Rather than talk about a childhood trauma, the silence is encouraged to become the heart child, the now. Our power is in the present. Nothing exists except the now. The past is gone and the future has not yet arrived. For many people, the power of the present is lost. They may focus on their past mistakes or engage in endless relationship resolution and plans for the future. Unfinished business. Feelings about the past are unexpressed. These feelings are associated with distinct memories and fantasies. Feelings not fully experienced linger in the background and interfere with effective contact. Result: preoccupation, compulsive behavior, awareness, oppressive energy, and self-defeating behavior. Layers of neuroses. First, links are the unfolding of adults, personality, the peeling of an onion. Funny layer, stereotypical and inauthentic. Phobic layer, fears keep us from seeing ourselves. Impasse layer, we give up our power. Implosive layer, we fully experience our deadness. Explosive layer, we let go of funny roles, contact, and resistance to contact. Contact, interacting with nature and with other people without losing one's individuality. Resistance to contact, the defenses we develop to prevent us from experiencing the present full. 5 major channels of resistance: introjection, retroflexion, deflection, projection, confluence. Therapeutic techniques. The experiment in Gestalt therapy. Preparing silence for experiments. Internal dialogue exercise. Rehearsal exercise. Reversal technique. Aggregation exercise. Reality therapy. Reality therapy basic beliefs. Emphasis is on responsibility. Therapy's function is to keep therapy focused on the present. We often mistakenly choose misery in our best attempt to meet our needs. We act responsibility when we meet our needs without keeping others from meeting their needs. Basic needs. All internally motivated behavior is geared towards meeting one or more of our basic human needs: belonging, power, freedom, fun, survival. Our brain functions as a control system to get us what we want. Procedures that lead to change: the WDEP system. W wants. What do you want to be and do? Your picture album. D. Doing to direction. What are you doing? Where do you want to go? E. Evaluation. Does your present behavior have a responsible change of getting what you want? P. Planning semic. Planning for change. Semic. S. Simple. Easy to understand, specific and concrete. A. Attainable. within the capacities and motivation of the silent. M. Measurable. Are the changes observable and helpful? I. Immediate and involved. What can be done today? What can you do? C. Controlled. Can you do this by ourselves or will you be dependent on others? Thoughtful behavior, our best attempt to satisfy our needs, doing active behaviors, thinking, thoughts, self-statements, feelings, anger, joy, pain, anxiety, psychologically. Bodily reactions. Behavior therapy. Behavior therapy, a set of clinical procedures relying on experimental finding of psychological research based on principles of learning that are systematically applied. Treatment goals are specific and measurable, focusing on the silence current problems to help people change maladaptive to adaptive behaviors. The therapy is largely educational, teaching silent skills of self-management. Exposure therapies. In vivo desensitization, brief and graduate exposure to an actual fear situation or event, including prolonged and intensive in vivo or imaginal exposure to highly anxiety evoking stimuli without the opportunity to avoid them, a movement desensitization and reprocessing. An exposure-based therapy that involves imaginal flooding, cognitive restructuring, and the use of rhythmic eye movement and other bilateral stimulation to treat traumatic stress disorders and fearful memories of silence. For aspects of behavioral therapy, 1. Classical conditioning. In classical conditioning, certain responsive behaviors such as knee jerks and salivation are elicited from a passive organism. 2. Operant conditioning. Focus on actions that operate on the environment to produce consequences. If the environmental change brought about by behavior is reinforcing, the changes are strengthened that the behavior will occur again. If the environmental change produces no reinforcement, the changes are lessened that the behavior will recur. For aspects of behavior therapy. 3. Social learning approach gives promise to the reciprocal interactions between an individual's behavior and the environment. 4. Cognitive behavior therapy emphasizes cognitive process and provide evidence as mediators of behavior change. Therapeutic technique use. Relaxation training to cope with stress, systematic desensitization for anxiety and avoidance reactions, modeling, observational learning, assertion training, social skills training, self-management programs giving psychological away, multimodal therapy, a technical athleticism, cognitive behavior therapy. Rational emotive behavioral therapy stresses thinking, judging, deciding, analyzing, and doing. Assumes that cognitions, emotions, and behaviors interact and have a reciprocal cause and effect relationship. Is highly didactic, very directive, and concerned as much with thinking as with feeling, teaches that our emotions stem mainly from our beliefs, evaluations, interpretations, and reactions to life station. The therapeutic process. Therapy is seen as an educational process. Clients learn to identify and dispute irrational beliefs that are maintained by self-indoctrination. To replace ineffective ways of thinking with effective and rational cognitions, to stop absolutistic thinking, blaming, and repeating false beliefs. View of human nature. We are born with a potential for both rational and irrational thinking. We have the biological and cultural tendency to think crookedly and to needlessly disturb ourselves. We learn and invent disturbing beliefs and keep ourselves disturbed through our self talk. We have the capacity to change our cognitive, emotive, and behavioral process. Irrational ideas. Irrational ideas lead to self-defeating behaviors. Some examples: I must have love or approval from all the significant people in my life. I must perform important tasks competently and perfectly. If I don't get what I want, it's terrible and I can't stand it. Aaron Beck's cognitive therapy. Inside focus therapy emphasizes changing negative thoughts and maladaptive beliefs. Theoretical deception. People's internal communication is accessible to introspection. Silence beliefs have highly personal meanings. These meanings can be discovered by the silence rather than being taught or interpreted by the therapist. Theory goals and principles of CT. Basic theory. To understand the nature of an emotional episode or disturbance, it is essential to focus on the cognitive content of individual reactions to stop upsetting event or stream of thoughts. Goals to change the way silence think by using their automatic thoughts to reach the core schemata and begin to introduce the idea of schema restructuring. Principles: automatic thoughts, personalized reactions, notations that are triggered by particular stimuli that lead to emotional response. CT's cognitive distortion. Arbitrary inference, selective abstraction, overgeneralization, magnification and minimization, personalization, labeling and mislabeling, polarized thinking. CT's cognitive threat, pattern that triggers depression. 1. Silent holds negative view of themselves. 2. Selective abstraction. Silent has tendency to interpret experiences in a negative manner. 3. Silence has a gloomy vision and protection about the future. Donald Meichenbaum Cognitive Behavior Modification Focus Silent Self-Verbalization of Self-Statements Premise As a prerequisite to behavior change, silence must notice how they think, feel and behave and what impact they have on others. Basic assumption: distressing emotions are typically the result of maladaptive thoughts. Meichenbaum's SPM. Self-interactional therapy focus trains silence to modify the interaction they give to themselves so that they can cope. Emphasis is on acquiring practical coping skills. Cognitive structure, the organizing aspect of thinking, which seems to monitor and direct the choice of thoughts. The executive processor, which holds the blueprints of thinking that determine when to continue interrupt or change thinking. Behavior change and copying. 3. Phase of behavior change. 1. Self-observation. 2. Starting a new internal dialogue. 3. Learning new skills. Coping skill programs. Stress inoculation training. 1. The conceptual phase. 2. Skills acquisition and rehearsal phase. 3. Application and follow-through phase. Constructivist narrative perspective. Focus on the stories people tell about themselves and others about significant events in their lives. Therapeutic task. Help silence appreciate how they construct their realities and how they alter their own stories. Feminist therapy. Key concepts of feminist therapies. Problems are viewed in a socio-political and cultural context. The silent knows what is best for her life and is the expert on her own life. Emphasis is on educating silence about the therapy process. Traditional ways of assessing psychological health are challenged. It is assumed that individual change will best occur through social change. Silence are encouraged to take social action. 4 approaches to feminist therapy. 1. Liberal feminism focus, helping individual women overcome the limits and constraining of their socialization patterns. Major goals: personal empowerment of individual women, dignity, self-fulfillment, equality. 2. Cultural feminism. Operation stems from society's devaluation of women's strengths, emphasize the difference between women and men, believe the solution to oppression lies in feminization of the culture. Society becomes more nurturing, cooperative, and rational. Major goals of therapy is the influsion of society with values based on cooperation. 3. Radical feminism focus, the operation of women that is embedded in patriarchy. Seek to change society through activism. Therapy is viewed as a political enterprise with the goal of transformation of society. Major goals: transform gender relationship, transform societal institutions, increase women's sexual and procreative self-determination. 4. Socialist feminism also have goal of societal change, emphasis on multiple operations, believe solution to society's problems must include consideration of class, race, other forms of discrimination. Major goal of therapy is to transform social relationship and institutions. Principle of feminist therapy: the personal is political. The counseling relationship is egalitarian. Women's experiences are honored. Definition of distress and mental illness are reformed. There is an integrated analysis of operation. Goals of feminist therapy: to become aware of one's gender role, socialization process, to identify internalized gender role messages and replace them with functional beliefs, take your skills to bring about change in the environment, to develop a wide range of behaviors that are freely chosen, to become personally empowered. Intervention techniques in feminist therapy: gender role analysis and intervention, to help silence understand the impact of gender role expectations in their lives, provide silence with insight into the way social issues affect their problems. Power analysis and power intervention. Emphasis on the power difference between men and women in society. Silence helps to recognize different kinds of power they possess and how they and others exercise power. Intervention techniques in feminist therapy: Bibliotherapy allows the silence to make an informed choice, reading assignments that address issues such as coping skills, gender inequality, gender roles, stereotypes, ways sexism is promoted, power differential between men and women, society's obsession with thinness, self-disclosure, to help equalize the therapeutic relationship and provide modeling for the silent values, beliefs about society, and therapeutic intervention discussed. Assertiveness training. Women become aware of their interpersonal rights, transcend stereotypical sex roles, change negative beliefs, implement change in their daily lives. Reframing. Change the frame of reference for looking at an individual's behaviors. Shifting from an intrapersonal to an interpersonal definition of a silence problem. Rebelling. Challenge the label or evaluation applied to the silence behavioral characteristic. Generally, the focus is shifted from a negative to a positive evaluation. Family systems therapy. Individuals are best understood through assessing the interactions within an entire family. Symptoms are viewed as an impression of a dysfunction within a family. Problematic behaviors serve a purpose for family, are a function of the family's inability to operate productively. Are symptomatic patterns handed down across generations. A family is an interactional unit, and a change in one member affects all members. Adlerian family therapy. Adlerians use an educational model to counsel families. Emphasis is on family atmosphere and family constellation. Therapists function as collaborators who seek to join the family. Parent interviews yield hunches about the purpose underlying children's misbehavior. Adlerian family therapy goals: unlock mistaken goals and interactional patterns, engage parents in learning experience, and collaborate assessment. Emphasis is on the family's motivational patterns. Main aim is to initiate a reorientation of the family. Multi-generational family therapy. The application of rational thinking to emotionally saturated systems, a well-articulated theory is considered to be essential. With the proper knowledge, the individual can change. Change occurs only with other family members. Differentiation of the soul, a psychological separation from others. Triangulation, a third party is recruited to reduce anxiety and establish a couple's relationship. Multi-generational family therapy goals: to change the individual within the context of the system, to end generation-to-generation transmission of problems by resolving emotional attachments, to lessen anxiety and relieve symptoms, to increase the individual member's level to differentiation. Human validation process model: enhancement and validation of self-esteem. Family rules: congruence and openness in communication. Sculpting, nurturing traits. Family mapping and chronologies. Human validation process model therapy goals: open communication. Individuals are allowed to honestly report their perception. Enhancement of self-esteem. Family decisions are based on individual needs. Encouragement of growth. Differences are acknowledged and seen as opportunities for growth. Transform extreme rules into useful and functional rules. Families have many spoken and unspoken rules. Experiential family therapy, a freewheeling intuitive, sometimes outrageous approach, aiming to unmake pretense, creative new meaning, and liberate family members to themselves. Techniques are secondary to the therapeutic relationship. Pragmatic and authoritative intervention create turmoil and intensify what is going on here and now in the family. Experiential family therapy goals facilitate individual autonomy and a sense of belonging in the family, help individuals achieve more intimacy by increasing their awareness and their experiencing, encourage members to be themselves by freely expressing what they are thinking and feeling, support spontaneity, creativity, the ability to play, and the willingness to be crazy. Structural family therapy focuses on family interactions to understand the structure or organization of the family. Symptoms are a byproduct of structural failings. Structural change must occur in a family before an individual symptoms can be reduced. Techniques are active, directive, and well thought out. Reduce symptoms of dysfunction. Bring about structural change by modifying the family's transactional rules, developing more appropriate boundaries, creation of an effective hierarchical structure. It is assumed that faulty family structures weigh. Boundaries that are rigid or diffuse, subsystems that have inappropriate tasks and functions. Strategic family therapy focuses on solving problems in the present. Presenting problems are accepted as real and not as symptom and system dysfunction. Therapy is brief, process-focused, and solution-oriented. The therapist designs strategies for change. Change results when the family follows the therapist's direction and change transaction. Strategic family therapy goals resolve presenting problems by focusing on behavioral sequences, get people to behave differently, shift the family organization so that presenting problem is no longer functional, mold the family toward the appropriate stage of family development. Problems often arise during a transition from one developmental stage to the next. Social constructionism. Deciding not the therapist is the expert, dialogue is used to elicit perspective, resources, and unique silence experiences. Questions empower family members to speak and express their desired positions. The therapist supplies optimism and the process. Social constructionism therapy goals generate new meaning in the lives of family members. Co-develop with family solutions that are unique to the station. Exchange awareness of the impact of various aspects of the dominant culture on the family, help families develop alternative ways of being, acting, knowing, and living. Athletic structural brief therapy. A therapy tourism. How many therapists does it take to change a light bulb? Just one, but the light bulb has to want to be changed. Rationale for ESPT brief model. How the therapist motivates silence to overcome their resistance. Silence stay in treatment for from 6 to 10 sessions. Silent report maximum gains after 3 to 6 sessions. Brief therapy models have been found to have no significant difference in their effectiveness than those of long-term therapy models. Therapists who hold to a brief therapy model have values and beliefs about what can and cannot be accomplished in therapy. Believe effective therapy results in the resolution of current problems and not in the mere modification of personality or character structure. Believe their job is to fix leaks rather than build a custom-designed house from the ground up. Exhibit behavior which reflects confidence in the efficacy of the established, challenging but limited goals for treatment. Work towards insight but also facilitates behavior change. Believe their primary goal is to initiate a healing process that can continue throughout the silence leaves. Why people seek out brief therapy. Most people don't desire lengthy process to uncover all substitutions and conditions rise which affect their mental health. They seek out therapy because they are in some form of crisis which affects their mental well-being. They want to find coping strategies which will assist them to alleviate their currently experienced pain. Brief therapy helps silence. Identify whether or not they are light bulbs waiting to be changed. See if a match exists in their temperament and personality styles with the therapist. See if right mix of motivation and simpatico between silence of therapists so change then occur in a brief period of time. If there is not a match, therapists need to encourage them to not pursue therapy until a readiness and willingness to do what it takes to change so that they can become turn-on light bulbs. Literature on brief therapy. Leaders in brief therapy include Bennett, Badman, Cummings, De Chazer, Halley, the MRI Group of Wickland, Fish, Segel, and Watzlawick. Strapp and Binder, Tellem and Wells. Reviews of the research repeatedly have found brief therapy as effective as time-unlimited traditional therapies regardless of diagnosis or duration of treatment. Long-term therapies. 1. Seek change in basic character. 2. Believe that significant psychological change is unlikely in everyday life. 3. See presenting problems as reflecting more basic pathology. 4. Want to be there as silence makes significant change. 5. See therapy as having a timeless quality and works if silence are willing to wait for change. 6. Unconsciously recognize physical conventions of maintaining long-term silence. 7. View psychotherapy as almost always being and useful. 8. See silence being in therapy as the most important part of silence life. Short-term therapies. 1. Prefer pragmatism, parsimony, and least radical intervention and don't believe in notion of cure. 2. Maintain adult development perspective from which significant psychological change is viewed as inevitable. 3. Emphasize silence, strange and research, presenting problems are taken seriously. 4. Accept many change will occur after therapy and will not be observable to the therapist. 5. Don't accept timelessness of some models of therapy. 6. Physical issues often mute either by the nature of the therapist's practice or structure for reimbursement. 7. View psychotherapy as being sometimes useful and sometimes harmful. 8. See being in the world as more important than being in therapy. Assumption about silence in brief therapy model. The silence have experienced faulty learning at some point in early life. The silence and their hurt environment interact and influence each other reciprocally. The interpersonal environment of the silence is never natural. it influences the silence positively or negatively. Although personality, character, social supports are all very important in people's life patterns, change in currents and change events are also prominent factors in shaping life's course. People understand experience, at last in part, on the basis of their stage of development. There will be little to no therapy achieved until the silence are ready to change. Critical therapist factors in brief therapy therapist must maintain clear, specific focus and structure, maintain active therapeutic role by suggesting activities or sites, collaborating and problem solving using text, homework assignments by asking questions, remain aware of the value of time in process each session be valued as vital to the desired outcomes. Make time between sessions spent in carrying on the therapeutic process by homework assignments, readings, journal writing, practice of new behaviors such as exercise, joining self-help groups, public speaking, volunteering, and trying new interactional patterns in the family, marriage, and work or school setting if applicable. Critical therapist factors to in brief therapy therapist must try new strategies, do something different, novel to motivate and challenge silence to deal with the presenting problems successfully. Be flexible, eclectic in variety of treatment modalities for individual, couple, family group. Use innovative session duration and rescheduling. See end of treatment as interrupting, terminating, encourage silence, recognize. Therapy is a process overall life cycle and can return on an as needed basis. Be clear with the silence relapse is a part of recovery. To return to therapy is not failure but good common sense. Recognize disincentives based of training programs to many therapies, financial survival need. Silence factor in brief therapy. Common belief that 85% to 90% of all silence are appropriate for brief therapy. Cost and shine indicate that individuals who appear to benefit most from brief therapy are whose problems had a sudden or acute onset, were previously reasonable, well adjusted, would relate well with others, had high initial motivation when entering the therapeutic process. Brief therapy may be inappropriate for individuals whose personal characteristics are in contrast to those noted above, and some types of psychological disturbances, substance abuse, psychosis, and personality disorders. Silence factors in brief therapy to silence must have an average intellectual ability and capable of understanding the issues involved, able to read and write in order to many of the assignments, be psychologically minded and open to psychologically oriented insight, interpretation, and suggestion. Have some social support system in place where they can turn for support and understanding during their time in the therapeutic process. Be motivated for change. Light bulbs that are ready. Have social orientation related problems in social context. Have clear present problems or principal complaint which can be identified in therapy. Have ability to collaborate with therapists in the process. Silence factors in brief therapy 3. Silence must have been able to have established at least one meaningful relationship in their lives, have capacity for rapid emotional involvement and equally rapid emotional separation, have good ego strength, have the ability to express feelings, have the expectation that therapy will be successful, be excluded based on the belief that therapists don't try to treat the untreatable. Therapists think all therapy, trial therapy for 3 sessions, and either transfer inappropriate silence, use alternative or adjunctive modality of treatment, or offer no treatment. Characteristic of eclectic structural brief therapy: 1. Theoretical basis. 2. Length of session. 3. Frequency and regularity of sessions. 4. Duration of treatment. 5. Location of therapy. 6. Initiation of therapy. 7. Termination of therapy. 8. Goals of therapy. 9. Therapeutic process. ESBT model flexible process of theoretical integration. 1. Limited and collaborative set realistic goal similar to reality therapy. Collaborate relationship between therapists and silence similar to person-centered therapy. Rapid and early assessment done by therapists utilizing techniques from systematic family therapy, focused interventions similar to the multimodal behavioral therapy, staying centered in the here and now, with the silence similar to existentialist therapy. ESBT model flexible process of theoretical integration. 2. Directed activity accomplished by the silence similar to cognitive therapy, ventilation of emotions similar to the Gestalt therapy, teaching how to identify and refute irrational thinking similar to rational emotive behavior therapy. Identify challenging and confronting psychological defenses similar to psychodynamic therapy, encouraging personal responsibility taking and accepting the social consequence for one's actions similar to Adrian therapy. Creative and efficient use of time. Selection process by which suitable silence who are light bulbs ready to be turned on are enrolled is this treatment model. Goal of techniques in ESBT: strengthen treatment gains, generalize learning from session to real experience, allow for learning of new skills or changing of an old skill, empower silence who are demoralized, wounded, and feel like outcasts. Enable silence to personalize therapy as something which they have done on their own. View selves as competent self-healers who can gain new coping skills and exchange old ones. Enables review self-confidence, increase self-worth, and exchange self-esteem. Tips of techniques in ESBT: initiating, aimed at exploring silence, presenting problems, gain understanding. Challenging, aimed at assisting silence to challenge their thoughts, emotions, and actions. Concluding, aimed at abolishing silence process and degree of change. Initiating techniques of ESBT: conduct a precision telephone call, mail out psychosocial medical history forms, assertion in the initial session if silence are ready for treatment or if someone else is pressuring them into treatment. Silence how soon they expect to be helped and what they see to be the obstacles. Train silence in problem analysis and goal setting. Explain the length and nature of ESBT treatment. Keep silent in the here and now. Operate an assumption length of treatment only one session. My initiating message in ESBT: our parents did the best they could knowing what they did at time. We as adults must now take responsibility for our own lives and learn what normal is so that we can have healthier, more productive lives. Challenging techniques in ESBT. Homework. Have the silent envision change. Use novelty and common therapy. Use one down position Columbo. Use humor in treatment. Focus silence role plays and current family. Utilize metaphor or paradox. Use crystal ball technique as challenging questions of silence. Encourage bibliotherapy. Homework in ESBT. Self-esteem development. Lifestyle of recovery. Family of origin behavioral interjected strips. And irrotational beliefs. Handling laws. Personal growth. Handling relationship, communications, and your work out, handling control issues, healing the inner child for self-healing. T system, thoughts, emotion, action. Alert system, assess, listen, ease out, relax, take steps. Anger system, accept, name it, get it out, exercise, release. Let go system, lighten it, exercise, right. Take steps, give up control, order life. Child system, calm, heal, inform, lighten, direct. Relapse system, recognize, exercise, learn, act, protect, support, evaluate. C system, mind-body connection, brain ration, reasoning, heart-gut. Involuntary organic system, heart rate, pressure, gastric acid, adrenaline. Immune system, concluding techniques. Post-treatment sculpting, journal review. Silence conduct therapy session with self. Contract silence to try it on. No therapy. Inventory where silent is at their time. Give silent a process report. Hallie's tips to consistently fail in brief therapy. Don't attend to presenting problem of the silence. Dealing with the silence past is essential, so deal with it extensively. Focus only on symptoms. Predict a worsening of the symptoms or symptom substitution. Our focus on silence, diagnosis, and criteria necessary for diagnosis. You must use only one theoretical framework. Don't be directive. Assume change must be observable to be real change. Insist on years of treatment to bring about change. Evacuate in the silence. Ignore the silence waiting quick results. Don't define goals in therapy. Don't calibrate with your silence. Assume a responsibility for success or failure the silence in therapy. Don't evaluate your effectiveness.
The meaning of counseling. Definitions of counseling. We have already stated that counseling is the most important part of the guidance program. We have also seen that the meaning of counseling in the professional sense differ from the popular understanding of the term. Now let us examine the meaning of counseling more closely. For this purpose, we shall analyze the various definitions of counseling. It will help us clarify the concept. Rogers describes counseling as the process by which the structure of the self is relaxed in the safety of the client's relationship with the therapist and previously desired experiences and perceived and integrated into an altered self. According to Hellman McKean, counseling is a one-to-one relationship between an individual troubled by problems with which he cannot cope alone and a professional worker whose training and experience have qualified him to help others reach solutions to various types of personal difficulties. Simit defines counseling as a process in which the counselor assists the counseling to make interpretations of facts relating to a choice plan or adjustments which he needs to make. Papesky defined counseling as that interaction which occurs between two individuals called counselor and client, takes place in a professional setting and is initiated and maintained to facilitate changes in the behavior of a client. According to Staffer, counseling is a learning teaching process. Gustad stated that counseling is a learning-oriented process carried in a simple one-to-one social environment in which the counselor, professionally competent in relevant psychological skills and knowledge, seeks to assist the client by methods appropriate to the latter's needs and within the context of the total personal program. To learn how to put such understanding into effect in relation to more clearly perceived, realistically defined goals to the end that the client may become a happier and more productive member of society. From the several definitions given above, it can be seen that counseling involves a relationship. It involves a relationship between a professionally trained, competent counselor and an individual seeking help. This relationship is not casual, matter of fact, or business-like. It is characterized by warmth, understanding, acceptance, and trust. Counseling and related fields. For a better understanding of counseling, it is necessary to study its relationship with some other fields. Counseling and psychotherapy. Psychotherapy is the treatment of problems of an emotional nature by psychological means. The fields of counseling and psychotherapy are having a lot of similarities as well as differences. Rogers had the view that counseling and psychotherapy are exactly the same. However, it is not totally true. We can distinguish both on the basis of individuals receiving help, persons giving help, severity of the problems covered. In psychotherapy, the person receiving help is generally called a patient who is suffering from some kind of mental illness. But in counseling, the person receiving help is generally a normal person facing some difficulties of adjustment or developmental problems. Secondly, the person who is given psychotherapy is called psychiatrist who has a basic medical background, whereas the counseling don't have any medical background but has extensive training on the field of psychology. Moreover, in psychotherapy, the aim is to cure a certain ailment. But in counseling, the aim is to help in self-understanding. It is more of a learning process. In spite of the distinctions mentioned above, it is very difficult to separate these two fields. There is more overlap than differences. In both, the aim is to assist the person to lead a more just and satisfying life. In both counseling and psychotherapy, the relationship between the client and the therapist counselor is of vital importance. Moreover, while handling emotional problems of a deep nature, counseling approaches psychotherapy very closely. Guidance and counseling. Guidance and counseling terms have been in use interchangeably. Laymen and sometimes even counselors use these terms as if they are synonymous, but it is not correct. But counseling and guidance are mutually related processes but not the same. Guidance is a more comprehensive process which includes counseling. Guidance services includes many other services apart from counseling. We may say that counseling is the most specialized and most important service in the whole guidance program. Instruction and counseling. Another term closely related to counseling is instruction. There are some basic differences between instruction and counseling. Instruction is usually obligatory to be followed by the person who receives it, whereas in the case of counseling, the counselee is not obligated to act according to anything said by the counselor. Actually, nothing is told to be done in counseling. Similarly, although the ultimate aim of instruction is the development of the individual, the immediate aim is the learning of a subject skill. But this is not so in the case of counseling. Moreover, the instructional program is time-bound and structured, but counseling, on the other hand, is not structured and no time limit is also fixed in the case of counseling. Advice of counseling. Counseling is sometimes confused with advice giving. It is necessary to dispel this confusion. Advice is sought with the conviction of being told what to do, and advice is given with the expectation that what is told will be done. The person seeking advice is not really responsible for the course of action and the consequence thereof. It is not always necessary for the individual to understand all factors related to his/her action. In counseling, on the other hand, the very understanding of all related factors is the crucial matter. Moreover, in advice giving, the advisor is making decision for the individual, whereas in counseling, decision making is wholly the responsibility of the counselee. Therefore, the counselor is fully responsible for his actions too. Advice given may be an incident and will be over in a brief meeting, but counseling, as we have seen, is a process. Principles of counseling. Counseling is based on a number of principles. These principles are: counseling is a process. It is necessary for the counselor to understand that counseling is a process and a slow process. Failure to understand this will result in annoyance and disappointment. Counseling is for all, especially in the school situation. Counseling is meant for all the students and not only for those who are facing problems or other exceptional students. As we have already discussed in the school situation, counseling is more developmental and preventive than remedial in nature. Counseling is based on certain fundamental assumptions. Every individual in this world is capable of taking responsibilities for himself. Every individual has a right to choose his own path based on the principles of democracy. Counselor doesn't deprive the right of self-choice but simply facilitates choice. The counselor should give due respect to the individual and accept him as he is. Counseling is not advice giving. Counseling is not thinking for the client, but thinking with the client. Counseling is for enabling the client to the judicious thinking. Counseling is not problem solving. The counselor simply assists the person to find solution on his own. Counseling is not interviewing, but conversing with the client in order to help him develop self-understanding. The counselor should determine individual differences and provide for them. The counselor has to prepare the client to open the criticism, including self-criticism. The counselor acts as a facilitator or catalyst only. He creates an atmosphere which is permissive and non-threatening throughout his warm and accepting relationship with the client, which helps the client to explore himself and understand himself better. The goals of counseling. Many consider counseling a panacea for all ills, which is not true. Individuals have wide-ranging and many a time unrealistic expectations regarding counseling. This in turn leads to disappointment. The reason for this state of affairs is lack of proper understanding as to what exactly are the goals of counseling. Some of the major goals of counseling generally accepted by counselors are given below. Achievement of positive mental health. An individual is said to have positive mental health when he is able to relate meaningfully with others and lead a fulfilling life. He is able to love and be loved. One goal of counseling is to help the individual to attain this state. Problem resolution. Another goal of counseling is to help the individual to come out of a difficult situation or problem. It must be remembered that the individual is only assisted and he himself finds solution for the problems. Counseling for decision making. Ability to make right and timely decisions is crucial for success in life. One major goal of counseling is to make individuals capable of making independent decisions. Counselor may assist the individual by providing necessary information or clarifying the counselor's goals, but the decision should be taken by the counselor himself, improving personal effectiveness. An effective person is one who is able to control impulses, think in creative ways, and has the competence to recognize, define, and solve problems. It can be seen that these different goals are not exclusive. These are all interdependent and overlapping. Help change. For development, change is always necessary. Counseling helps individuals to make changes in their attitudes, perceptions, or personality. Behavior modification. Another aim of counseling is to help in modifying behavior, removal of undesirable behavior or self-defecting behavior, and learning desirable behavior is considered necessary for attaining effectiveness and good adjustment. The behaviorally oriented counselors are the chief proponents of the view. The major approaches to counseling. The practice of any profession is based on a system of beliefs and assumptions, generally called a theory. Counseling is no exception. In the case of counseling, though many elaborate theories have been proposed, no single theory explains all aspects of the counseling. Therefore, the term approach is generally preferred because it is a more comprehensive term. An approach provides a coherent definition for the counseling process as a clear statement of counseling goals, a rationale for selection of a particular counseling techniques. There are three major approaches to counseling: the directive approach, the non-directive approach, and the eclectic approach. The directive approach, as the name itself implies, the approach envisages a more active role for the counselor. The counselor employs varying degrees of direction to help the counselee to reach sound solutions, also through his own specialized knowledge and experience in scientific diagnosis and interpretation of data. Counselors are helped to reach earlier solutions for their problems. According to Frederick Thorne, the proponent of this approach, the need for direction by the counselor is inversely proportional to the individual conjugal potentialities for self-regulation. So the basic responsibility for reaching the solution is primarily with the counselor as the counseling proceeds. Counselors are encouraged more and more to take up increased responsibility for self-direction. This approach presupposes a more personalized relation with the counselor, where the counselor strives to identify psychologically with the counselor so that he can be understood better. Counseling steps. Directive counseling involves 6 stages. They are as follows. Analysis. This involves collecting from various sources the data needed for an adequate understanding of the client. This includes administration of psychological tests. However, such testing and form filling should not come between the counselor and counselee, and its importance should be limited to the extent that it gives a better idea about the counselee. Synthesis. This refers to summarizing and organizing the data so obtained as to reveal the assets, liabilities, adjustments, and maladjustments of the counselee. This includes all the data obtained through psychological testing also. Diagnosis. This stage is concerned with formulating counselings regarding the nature and the course of the problems exhibited by the students, drawing conclusions from the results of psychological testing, administration of questionnaires are done here. Prognosis. This refers to predicting the future course of development of the counselee's problem in the light of consultations as made earlier. Counseling. This is the most important and time-consuming step in the whole process. This is where the expertise of the counselor is needed most. It is a highly personalized teaching and learning process. It may be direct teaching through explicit explanations, assistance in searching for relevant aptitudes, interests, etc. that illuminate the counselee's problem and so on. Sometimes the counselor listens in a friendly, encouraging way. It may also involve practice sessions where, with the warm support of the counselor, the counselee acts out the way he should. Thus, he becomes his own teacher to the extent his capabilities and circumstances permits. Success thus achieved reinforces and retains those successful behaviors, which in turn establishes an adjust way of life. Thus, counseling involves assisting the student in self-appraisal, identifying his interests, motives, and capabilities, helping him to plan a course of action which utilizes the capabilities and potentialities so identified, and finally in establishing an adaptive lifestyle to help the counselee apprise him. Two types of data are needed: self-perceived data and data from external appraisal. The counselee himself is the best source of certain type of information. However, the counselors should also communicate those information obtained through analysis and diagnosis. However, he should be cautious enough not to make the counselor think both of them are in the same state of ignorance. Counselor doesn't enumerate in detail the steps of his analysis, diagnosis, etc. But the counselor is given an overall idea. He should avoid a dogmatic position, but through his theoretical knowledge, experience, and judgment assist the counselor. The counselor should not at any time appear indecisive because it can cause loss of confidence in him. He should maintain a varied and running discussion of the case data, taking clue from the constantly changing facial and verbal expression. Does the counselor cooperate with the counselor to reach a valid interpretation of the case and an effective program of adaptive behavior changes? Non-directive counseling. In this approach, the counselor provides an atmosphere in which the client can fully explore her own thoughts and feelings freely without any fear or pressure. This by making the counselor understand her potentialities. The counselor acts as a catalytic agent. Here, this search of data is the client, him, and the responsibility for change rests with the counselee rather than the counselor. The counselor shouldn't be as passive as trying to keep out clients' way, nor should be as active as to shift the focus from client to counselor. Central hypothesis. Carl Rogers, the chief proponent of the client-centered approach, has formulated the central hypothesis as follows. The individual has within him the capacity, latent if not evident, to understand those aspects of him and of his life which are causing him dissatisfaction, anxiety, or pain, and the capacity and the tendency to reorganize him and his relationship to life in the direction of self-actualization and maturity in such a way as to bring a greater degree of internal comfort. This capacity will be realized when the therapist can create a psychological climate characterized by genuine acceptance of the client as a person of unconditional worth, a continuing sensitive attempt to understand the existing feelings and communications of the client as a person of unconditional worth, a continuing sensitive attempt to understand the existing feelings and communications of the client, and a continuing attempt to convey the empathetic understanding to the client. It is further hypothesized that in such an accepting, understanding, and non-threatening atmosphere, the client will reorganize him. The adjusted way of life as achieved in the therapeutic relation with the counselor will be generalized to real-life situations as a whole. Thus, the whole idea of the theory is that the clients are capable of correcting misperceptions or incongruences between self and experience. In the accepting environment of a counseling situation, if the counselor possesses some personal qualities like congruency, unconditional positive regard, and empathy. However, this theory underestimates the need for the counselor to be an expert in behavior dynamics, problem-solving techniques, or developmental processes. Moreover, Rogers rejects the use of diagnosis, testing, and other such techniques, saying that they hinder the client's natural growth. Instead, he stresses listening, paraphrasing, reflecting clients' comments rather than interpreting direct questioning. Eclectic approach. Here, the counselor bases his counseling on concepts taken from various available viewpoints. He owes on specific theoretical elegance. Instead, incorporates those procedures and techniques which he believes to be most effective in the case of that particular counselee without any prejudice or bias to any particular school of thought. According to Turn, eclecticism is the most practicable and apt approach to counseling, because no two people are able, and as such, no single theory or personality could explain the various behavioral patterns exhibited by individuals. So also, each problem is unique in its content and intensity, and a technique or approach suitable in one case need not even be effective in the second case. This suggests an approach which is tailor-made to handle individual cases, and eclecticism advocates this neopant. Thorne has coined the word integrated psychology to express his eclectic view. Its theoretical foundations are based on the following postulates. All psychological conditions are examples of disorders of integrations, and the goal of psychological counseling is to strengthen this integrative process, thus fostering his levels of self-actualization. The focus is therefore the person in the present situation, The therapist has to assess whether the client has the necessary resources to take on the responsibilities of life. If the therapist is satisfied, he gives the client the responsibility of taking on some routine tasks to start with. Therapy involves the training and reduction of the client in acquiring the controls necessary for self-regulation. Thorne uses the term psychological case handling instead of psychotherapy. Steps involved in psychological case handling are systematic diagnosis to obtain a complete picture of the client's problem, understanding the various counseling methods in terms of their strengths and limitations, concentrating on the underlying causes rather than symptoms, choosing a specific method suited to the needs of the client, evaluating the method on the basis of the results obtained, scientifically analyzing the data and evaluating the result. Multimodal therapy, organized by Arnold Lazarus, is yet another example of eclectic approach. He explains 7 major areas of personality function: behavior, affective, sensation, images, cognitions, interpersonal relationships, and drugs, biological. He uses the acronym BASIC ID to encompass all these modalities. An important feature of the approach is the insistence that every individual is unique with his own basic ID. Maladaptive behaviors are assumed the result for faulty learning, and the goal of counseling is to bring about client desired changes that will be enduring, and to accomplish this in an efficient and humane way. Counseling process. Counseling starts with filling out a life history questionnaire, where the effective in the case of that particular counseling. It includes reinforcement procedures, assertiveness training, desensitization, feedback, and cognitive restructuring, especially in behaviors, affective and cognitive modes. In physical, and imagery modes, he uses Gestalt and holistic techniques such as empty chair of role, reverse dialogue, confrontation, abdominal breathing, positive visual imagery, and focusing. Self-management, instruction in parenting, and social skills are used in interpersonal modes. In drugs and biological mode, this is for the use of appropriate medicines and curtailing inappropriate individual behavior are assumed to result from faulty social learning in the basic. The term counseling in the professional sense is always concerned with helping others irrespective of the context in which it is used. Here, it is all the more so since the person as a whole is our focus of attention rather than a specific problem. Counseling can best be described as a process. It means that counseling involves a sequence of identifiable events spread over a period of time. The time taken, the sequence of events and dynamics involved, the nature and extent of exploration differ from individual to individual. However, there are certain basic stages which form the part and parcel of each of such counseling processes. But before going into the details of it, we will acquaint ourselves with some of the related concepts. Readiness. Clients broadly fall under two broad categories. The first consisting of those who seek assistance voluntarily, and the second comprises those referred. Whatever the case be, counseling presupposes a desire on the part of the counselee that makes the client come for assistance. This desire is referred to as readiness. Contrarial. Often people experience difficulty in asking for help and accepting it as well, because in some cases they are reluctant to face the consequences of change, and for some receiving help means an admission of inadequacy or failure. Some feel that they need no assistance or cannot be helped at all. This negative feeling that holds back one from seeking help is referred to as contrarial. Case history. This is a term very often used in this field. A case history can be defined as a systematic collection of facts about the client's present and past life. However, the focus of attention varies with the theoretical orientations of the counselor, like a psychoanalytically oriented counselor looking for relevant childhood experiences. Report. The importance of report in counseling cannot be overemphasized. It is a warm, friendly, and understanding atmosphere created by the counselor which is catalytic in the formation of an effective counseling relationship. Warmth of relationship, communication of the warmth to the counselee, and feeling of trust which grows out of unconditional acceptance are all important factors contributing to the establishment of rapport. Moving out to receive the client, greeting him warmly, putting him at ease, and directing his attention away from the problem initially are some of the techniques that can be used. Transference. It refers to the client transferring to the therapist emotion originally felt towards significant others in early life. This is quite natural in counseling situation because the client trusts counselor and is encouraged to express his feelings and emotions freely. As a counselor, one should acknowledge these feelings and should be handled in a therapeutic way, lest the relation should break down. Countertransference. This phenomenon is said to occur when therapists project their unresolved conflicts upon the client. When counselors feel uncomfortable with the client or experience irrational feelings of anger, resentment, or when they tend to foster dependence on clients or become over emotionally involved. We can infer that countertransference has set in persistence of such feelings is not healthy, and the counselor himself should seek professional help if reasoning out by self doesn't improve his condition. Resistance. It refers to clients' inclination to oppose the counselor's attempts to work towards set goals. Recent trend is to view this as an expected part of counseling and is found to influence counseling outcome positively. Resistance ranges from open hostility to passively resistant behavior like being late for an appointment. Stages. The process of counseling passes through certain stages which can be broadly classified as follows. Initial stage, client self-exploration. Here the clients are encouraged in self-exploration and their concerns are clarified. General counseling goals are set and the working alliance is established. Also, by gathering information and observing the client, the counselor arrives at some tentative hypothesis regarding the nature and complexity of the problem. To help in these decisions, assessment devices like psychological tests, questionnaires, inventaries are widely used. The initial stage is subdivided into first interview and initial counseling sessions. First interview. Its primary objective is to set the foundation for an effective working relationship. This is the most challenging stage. Client approaches the counselor with a feeling of uncertainty and ambivalence. Counselors throughout their words, facial expressions, and overall behavior conveys his understanding and acceptance of the client and his sincere interests in his problem. Simple courtesies like sitting the clients comfortably, avoiding interrupting phone calls are very important in the development of rapport. During the interview, the counselor needs to make a tentative decision whether the task at hand is within his expertise. If not, it is necessary to refer the client to an appropriate professional agency. Clients should be made aware of what can be expected out of counseling and what they are hoping for. Confidentiality, rights of privacy, other ethical and legal considerations needs to be clarified. Discussion about the length of sessions, payment of fees, arrangements of mutually appropriate meeting times are also done now. Initial counseling sessions. Here, the counselor must listen to the client's concerns and encourages the expression of feelings without undue questioning. This information is gathering by active listening, attending to clients' self-talk, observing his body behavior and other reactions, to be used later in deeper explorations. If clients have difficulty in expressing non-threatening questions can help. Middle stage, deeper exploration and analysis. This stage is marked by a shift of counselor attention from client's external problem to his internal problems from primarily cognitive level to emotional level. Thus, the client discloses feelings increasingly. Counselors explore more intensively with clients, confront him with contradictions, stronger interpretations of clients' comments. At this point, some counselors use more tests to further explore into the client's intellectual or personality functioning. Thus, as the client moves to increased disclosure and awareness, counselor and clients begin to develop emotional interactions like transference, countertransfer resistance. Thought rooted in psychoanalysis, experts are of the opinion that these are universal phenomena in all counseling relationships. Final stage: implementation of goals through action. By this stage, clients would have started acting upon reality. They become more self-aware, assertive, and genuine, and start generalizing these to everyday life. This is a working throughout phase in which understanding is put into constructive action. Emphasis is on making changes in behavior, attitudes, and skills specified as goals in the initial stages. For those who delay decision-making, specific strategies like role-playing behavior, rehearsal, assertiveness training are used. Termination. If the goals as set in the beginning are met, termination follows. If the counselor believes the problem has been solved, he may raise the issue directly, or if the client is sure to have recovered, he may bring up the idea. If the counselor agrees, termination proceeds. However, the counselor must be alert to the possibility that effort to termination arise due to lack of progress. Also, he should be aware that client signaling termination is a sign of resistance and should be handled carefully. If termination is reasonable, counselor must use less few sessions to win the clients. They often feel a renewal of symptoms, grieving, sadness, or separation anxiety. When counselor manages termination successfully, he maximizes counseling outcome as well as maintains new learning in later life situations. There have been many attempts at identification of the characteristic of an effective counselor. General characteristics. The National Vocational Guidance Association of USA has listed such characteristics as interest in people, patience, sensitiveness, emotional stability, and objectivity as important. Harmon and Paulson listed understanding sympathetic attitude, friendliness, sense of humor, stability, patience, objectivity, sincerity, tact, fairness, tolerance, neatness, calmness, broad, mindedness, kindness, pleasantness, social intelligence, and poise. According to Hauer, personal maturity is the most important desirable characteristics to be an effective counselor. Association for Counselor Education and Supervision holds that there are 6 basic qualities with belief in each individual, commitment to individual human values, alertness to the world, open-mindedness, understanding of self, and professional commitment. Variables like age, sex, experience also, to a certain extent, are found to affect counseling process. Clients were found to be confident in the ability of younger counselors. Experience increases with age and counselor improves with experience. Generally, female clients prefer to discuss emotionally loaded problems with female counselors. Sex of the counselor is important depending on the client's ease or difficulty with which they can discuss their problem to the same or opposite sex. Personality characteristics. Several studies have been conducted to identify the personality characteristics basic to effective counseling. Weights. Cinder and Cinder and Styler have suggested the following traits. Interest in helping people. If the counselor has a basic interest in helping others, the clients will feel more comfortable in their presence and this will increase the effectiveness. Perceptual sensitivity. Counselors should perceive and understand the thoughts and feelings of the clients as well as the clues given by him. Personal adjustments. Counselor should be a well-adjusted person if he should be effective in solving others' problems. Personal security. Waite suggests that the feeling of security in the role of a counselor is a very important factor in effective counseling, even though insecurities outside this area and other life situations is rather not that important as far as effectiveness is concerned. Genuineness. Rogers suggests that counselors should be able to establish a genuine relationship with the client to achieve the counseling goals to the best. Counselor attitudes and beliefs. This is important because it determines the nature of the counseling relationships formed. These are as follows. Beliefs. Counselors should believe in treating the clients with dignity, equality, and individuality. He should believe in the worth of and value of the counseling and in his need for freedom and liberty. Here, liberty means the power to strive for goals without external constraints. Values. Williamson points out that counselors cannot be indifferent to social and moral standards, and nor should they be neutral. Salmer states that counselors should be fully aware of social values and expose it also because a change in value constitutes an important counseling goal. Acceptance. Rogers defines it as a warm regard for the client as a person of unconditional self-worth and of value no matter what his condition, his behavior, or his feeling are. It implies a respect and liking for the client as a person. Tyler identifies two basic components of acceptance: willingness to set individuals differ from one another in their behavior and realization that experience of each person comprises a complex pattern of striving, thinking, and feeling. Thus, the counselor should have a non-judgmental attitude, and this implies helping an individual and not controlling him. Understanding. Tyler defines understanding as the ability to grasp clearly and completely the meaning the client is trying to convey. Counselors should be able to participate completely in the client's communications, and his comments should harmonize with what the client is trying to convey. Counselor skills: rapport, attentiveness, and empathy are the three skills needed to facilitate counseling. These are closely related to acceptance and understanding. Rapport. Rapport refers to that atmosphere created by the counselor at the initial stage of the counseling process by which a comfortable and unconditional relation with the counselee is established. Attentiveness. To establish rapport, the counselor has to take into consideration the needs, moods, and conflicts of the counselee into consideration, and for this a friendly and attentive attitude on the part of the counselor is necessary. Empathy refers to feeling into Diamond describes empathy as the imaginative of oneself into the thinking, feeling and acting of another, and so structuring the world as he does. This is a significant factor in counseling. So far, we had been discussing various characteristics which are needed to be an effective counselor in the viewpoints of different persons over a period of time. Now, to summarize, we can say that by looking at three factors, we can distinguish an effective counselor. Experience. Well-trained and effective counselors agree with each other on various counseling concepts and offer more empathy and are more successful in communicating with their clients. The counseling relationship, it is characterized by a better understanding of their clients. They can maintain an appropriate emotional distance and divest themselves of status concerns. Non-intellective factors. These include tolerance for ambiguity, ability of understanding of the client, maturity, and ability to establish good social relationship with all.